Okay, I hope you all enjoyed good conversations over lunch. Let's settle in. We've got more time to talk as the day goes on. And now I'm delighted to get us going on a panel on data veracity and model validity as ethical challenges, and it raises many of the issues that we already heard a bit about this morning. So without further ado, I would like to introduce Kay Husbands-Feeling, who is chairing the panel, and she's visiting us here from Georgia Tech, so thank you very much.
Thank you, and good afternoon. I'm happy to be here with everyone. Hopefully you had a terrific lunch and great conversation. I saw lots of tables and a good bit of engagement. So I just want to introduce this panel to you. As you just heard, it's data veracity and model validity as ethical challenges. There are 3 presenters and 1 discussant. I'm only driving the train. I'm the chair. I'm going to sit in the back and make sure we go on time, 20 minutes per presenter, as well as we'll have a few comments also from the discussant. The 3 presenters will be Naren Ramakrishnan, Edgar Chow, and Kilian Vieth, as well as, and Kevin Finneran will be discussing the presentation shortly, and then we'll have a good bit of time for discussion. The variety of big data sources are listed here on the slide. The one that I learned about more recently is uncomfortable data, which was an interesting way of saying it. Oftentimes the discussion revolves around volume, velocity, and variety, and especially now that so much is in the shared economy and the data access to is increasing to a variety of data about which we don't know oftentimes a lot about. The Internet of Things and all kinds of sources for these types of data are listed here on this slide. But basically what I wanted to get to was to set up this presentation and this discussion by thinking about all the things that we like to ask of these data. What do the data tell us? Is there a causal relationship, or are we just looking at correlation? What does statistical significance mean when you're looking at large, very large data sets? What is the appropriate model to use? What is the framework that makes sense using these data? What are the privacy, confidentiality, and ethical issues? One of the focal points of this workshop. Do we need informed consent to link administrative data, administrative records to other databases? This is something I work on as I do some work on the food safety area. How does power, political and financial power, shift because of access to and use of big data? And do these data make us smarter? You hear about smart grids, smartphones, smart cities. Does this really make us smarter that we have the access to these data? These and a lot of other items will be talked about very shortly by our 3 presenters. So again, we have Dr. Naren Ramakrishnan. He will talk about veracity, validity, and ethical challenges. He currently directs a multidisciplinary effort to tackle knowledge discovery problems in areas of national interest. And in his presentation, he'll focus in on a bit on surveillance, forecasting, and ethics. Dr. Edgar Chow, he is going to speak about the impact of electronic health records, or EHR, and operational procedures in healthcare data for research. Dr. Chow is focused in terms of his research on healthcare disparities, preventative medicine, resident education, and leveraging health information technology toward improving or improvement of healthcare delivery. And on focal points for his presentation will be efficiency and precision, expectation of privacy and confidentiality, and meaningful use, a term that we've heard quite a bit already in the early morning session. And the last presenter will be Kilian Vieth. His presentation is titled Human Rights and Performing Security Through Big Data. He is, Dr. Vieth is working on critical security and surveillance issues and digital labor and ethical algorithms. And in his presentation, you'll hear a good bit about security, risk, and algorithms as well. So without further delay, I would like to bring each Dr. Ramakrishnan up to give his presentation. We'll follow through with each presentation in sequence. As I said, Kevin will give his discuss remarks, and then we'll go to the Q&A period. I'm not going to get back up, and I'll just drive from the back of the room. So let me just put up the first presentation, and I'll let you open that up. So please welcome Dr. Ramakrishnan. Here
Thank you. Thank you very much. Can you hear me without the mic? No? I have to hold it here. Okay. So thank you very much. It's great to be here. I was talking to my panelists to see where they would come from, and then they asked me where I came from. I told them I came from the 5th floor. Wasn't as impressive as some of your other journeys. So this is the context for what I'm going to talk about. I've been directing two projects, two very different projects, and so all the lessons that I'm going to share here are lessons learned from these two projects. The first project sounds a little bit like Minority Report. For those of you who have seen that. It was funded by IARPA, the Intelligence Advanced Research Projects Activity. For those of you who might have heard of DARPA, IARPA is similar to DARPA but for the intelligence community. And they had a program which recently concluded called Open Source Indicators. And the goal of that program was to take publicly available data, any data that you could reasonably get your hands on, and use that to forecast significant societal events, what they refer to as population level events, events like disease outbreaks, civil unrest, elections, mass migrations like what's happening in Syria, for instance, responses to natural disasters, and so on. So I'll talk a little bit about this project and what we learned from it, especially the ethical issues as they pertain to this workshop. The second project is more sober. It's an ongoing project. It was funded by NSF, by their National Research Traineeship Program. This is a traineeship award to train PhD students in the interdisciplinary practice of urban data science. So how do we train students to become data scientists, to work in problems that are faced by cities? How do you cast these problems as data science problems? How do you use the methods of data science to solve these problems, and so on? The first project, EMBERS, like I mentioned, is focused on forecasting these events. And we focused on countries in Latin America, Mexico, Brazil, and many countries south of that. This was a project where, as researchers, we were given complete autonomy to go and fetch any publicly available data. That was the only constraint. Go and get any publicly available data, which includes news, tweets, blogs, weather information, Wikipedia, food prices, stock market indicators, currency prices, anything that you could get your hands on without knowing Mark Zuckerberg personally or something, that's available to anybody. And they asked us to forecast these events, and to prove that you really forecast these events, we have to email these forecasts ahead of time. Okay, so I can't claim to have forecast Arab Spring after the Arab Spring. So, and to verify that you really forecast them, they had a separate team whose job it was to look at newspapers and catalog the events as they really happened. And at the end of the month, they will take the forecast that you sent, the events as they happen, and they'll match them and they'll give you a report card. And so this was run as a forecasting tournament. There are a lot of websites that do forecasting competitions like this. So this was run as a tournament with 3 teams, and the Virginia Tech-led team was declared as the winner after a period of 2 years. So what you see here is the EMBERS dashboard. And you see here there's a big hotspot in Mexico, which indicates there's going to be a lot of civil unrest happening in Mexico. There's some activity in Brazil, Paraguay, lesser activity in Colombia, Ecuador, and so on. The team had a mix of people from many different backgrounds. In addition to computer scientists, we had social scientists, we had epidemiologists, we had political scientists, we had people who are experts in these regions, we had people who knew these languages, Spanish, Portuguese, and so on. So it was a truly diverse group that we brought together to make these forecasts. So before you conclude that this has some very nefarious purpose, there are a lot of legitimate reasons why you would want to forecast protests. So for instance, if you are interested in monitoring the supply chain for some particular product or sector, and your supply chain goes through these countries, you would want to know if there is going to be societal instability in these countries that will affect your supply chain. If you're local law enforcement in these countries, you would want to worry about traffic, issuing travel alerts, and so on. Even if you're a politician, and you would want to know what are people really unhappy about, and if you want to prioritize your citizens' grievances, trying to determine what they're really unhappy about, and so on. But some of the ethical issues that we encountered have to do with, of course, surveillance. We are monitoring all this data here, and I don't know how many of us know that when we tweet, Twitter is reselling the data back to people like me, right? Facebook, many of you know this Facebook study that came out in PNAS, where they actually conducted live experiments. They were not just reselling your data; they were actually adjusting your news feed and seeing what happens to your reactions and so on. So there's a lot of issues that happen due to surveillance, but there are also a little bit more subtle questions here. For example, even though we might claim that we are aggregating data, that we are not really looking at individual level data, we're looking at population level data, there is a notion of collective privacy that you could talk about. So, for example, you might be able to localize the issues raised by a subset of the population in a particular region, and is that something that you would want to highlight? And then just the quality of forecasts. This is where the veracity and validity issues come in. What happens if your forecast was incorrect? What happens if you made a forecast that was wildly, off mark? What happens to all the expended resources that went into it? What if you took preventive action due to incorrect forecasts? So there are a lot of issues that we did not study in this project, but these are interesting issues when you think about implementing a data analytics or any machine learning model in a longer pipeline that has decision making at the end of it. So I'm looking forward to discussing some of these issues with you. The second project I want to briefly quickly talk about is called urban computing. This is a project where we were motivated by the fact that population growth is significantly moving into the cities. That very soon 7 out of 10 people or even more would be living in a city, and so asking the questions: what are the problems that are going to be caused due to increased urbanization, and thinking about every issue that might face these large urban populations that have to do with everything from public health to sustainability in terms of energy resources, sustainability in terms of your transportation needs, and also societal stability considerations and so on. So what we did at Virginia Tech was to bring a group of departments together: computer science, math, electrical engineering, sociology, population health sciences, civil engineering. Every department that has some stake in populations, brought them together to create this curriculum in urban computing. And we are recruiting an interdisciplinary cohort of students who will go through this curriculum, take a set of introductory courses, and at the end of it, we are preparing them to become data scientists who can solve a specific issue that faces cities using the methods of data science. So as whenever you hear about smart cities and so on, and some of my panelists are going to be talking about that as well, there are going to be a lot of issues that come up here. So one of the first things that you would claim is that in many of these smart city applications, the use of personal identifying information is limited. Don't believe it. Because every time they say, I don't have your name, I don't have your social security number, all I have is your phone SIM card number, that's enough, right? Because you might think the SIM card doesn't say anything about you, but it actually tells a lot, right? So anybody who claims they don't have personal identifying information, every app that you click yes, when it asks permission, I want permission to see everything about you. Well, you just gave it, and right there you're online, right? So So even though the specific information about who the individual is not present, there's a lot of auxiliary information that can be combined to essentially create a profile of you. But there are other more subtle forms of profiling that happen. So there's a lot of attention being paid to predictive policing nowadays, where you're essentially profiling entire neighborhoods. You're going to be saying that this neighborhood is going to see an uptick of a certain type of crime, certain type of violations or something. And so even when you try to position resources, marshal extra constables or something, you're going to have a lot of ethical issues. So recently there's been a lot of discussion about what happens when these predictive policing algorithms are wrong, right? And they have been wrong. They're not foolproof. So there's certain issues there. There are issues that come up again in this urban setting due to discriminative pricing structures. It has to do with everything from housing to electricity. People design policies intended to keep specific segments out of the market, or they're able to actually profile this, do things in one way, but in reality, they have the opposite effect of excluding a portion of the population from something. You can model movements. The GPS behavior of your phone tells you a lot about your daily life, and I could predict where you're going to go next just based on the first few destinations. Uber, for example, looks at the first few roads that you take in your road, and it can actually tell you where you're going, right? And you might call it a recommendation system, or you might call it a privacy violation system, right? Depending on where you come from. And there are also a lot of issues that come here about modeling of specific subpopulations who have to be monitored and targeted for other reasons, but they end up having a lot of side effects. For example, you could go online and try to, you can get a lot of information about people who have been released on probation, where they are, and you'll know that they're working in the nearby Starbucks or Panera, and you can create a map of, all these folks, and that's going to, have a lot of implications for everything from, housing to, any other type of societal, issue here. So there's a lot of issues that come up again in this urban computing context. So what we did, what we proposed in our proposal to NSF was we are creating a specific special course called Ethics and Professionalism in Data Science. So in the course I teach, for instance, every assignment has an ethics question that basically says, okay, now that you've figured out this algorithm, pretty cool. Okay, let's think about ways it can go wrong. Okay, what are issues that will come up? And we want students to consciously start thinking about these issues and determine, start putting on the hat in the other direction and see, okay, just because we can do it, should we do it? And if we need to do it, are there safeguards that you can put in place? Are there measures that you can put in place, to control this? So I'll stop here. Happy to answer any questions at the end of the session.
Okay, so I'll cover a couple items that you heard throughout this morning and go in a little more detail as it relates to them. And just to start off, some of the goals as part of this discussion is to understand the underlying drivers related to the design of an electronic health record and what led to that. And as such, how does that impact the data integrity, which has a lot of implications that you've heard earlier today, and some of the limitations as the way it's designed today. Disclosures to report, just a little background about Drexel. So in terms of us, in terms of the medical clinical aspect of it, we have a multi-specialty practice, over 250 physicians, multiple subspecialties, a number of trainees in terms of residents and fellows, medical students, as well as a number of outpatient visits per year. And we've had the EHR since 2007. So we actually started the implementation of this prior to all these other initiatives. And with that, one would think we have a trove of data that we can now benefit from, and just talk a little bit more about some of the issues related to that. So when we talk about how things have derived and how we've gotten to where we are. Little slide here depicts about how, in terms of the clinician side, so I'm an internist, so I practice medicine still, and I have a number of colleagues that react to me because I serve as the pusher, if you will, of the electronic health record, and I hear things from them, and they give me a lot of feedback, so positive and negative, I get all of it. So one of the things they blame, who do they blame? So they blame, is it the insurer or whatnot? So this is an example of some people's feelings towards these different things, but how did we get here? So taking a step back in 2001, so Dr. Diaz-Roux talked about the Institute of Medicine, their recent publication, but back in 2001, publication was made by the similar group talking about how do we deliver better healthcare. And you may have heard already to err is human, multiple preventable deaths, so kind of move forward into this area of healthcare needing to be safe, effective, patient-centered, timely, efficient, equitable, and using electronic health records was basically one of the key ways of doing it. So how do we do that? This had to be adopted by healthcare organizations, professional groups, private purchasers, but the goal of this is decreasing the burden of illness and improving the health of patients and their populations. And patients being more empowered in their control. So these weren't new concepts, even though these seem to be newer things that have come into place. Information to flow freely between different groups, transparency, trying to anticipate needs, predictive modeling, so terms that we've heard quite a bit about, and the fact that we spend a lot of money. And the fact that we spend a lot of money, but at the same time not ranking at the highest as other developed countries in terms of the quality of care that's being delivered. So one of the things that came out of this was meaningful use, and you've heard of that phrase, I'm sure, or maybe not, but if you haven't, as Dr. Diaz-Roux had mentioned, this is the government's effort to incentivize physicians, and now it's in a penalty phase, because if you don't do it now, you get penalized, but to incentivize physicians to use electronic medical records and use it meaningfully. And as such, this, if people don't know, is the program. So obviously you can't make heads or tails of it, but all the details of the program are laid out in this grid. And so one could imagine, why is the data not that great? Well, there's actually a lot of components to the program. So this is the summary of it. There's a citation if you want to look at that. But despite billions, over $20 billion have already been spent to date on this initiative, people have adopted electronic medical records. So this slide depicts how well organizations have done, certified EHR, so their certification process, 97% as of the data as of 2014 have adopted the certified electronic health record. So again, one would think, wow, we have all this data that's available. So one of the things that has also come out of these initiatives of delivering care is something people may have heard about called the Triple Aim. Again, out of the Affordable Care Act, delivering care to improve the care of populations, how to do it cost effectively and improve patient satisfaction. So this came out of the Institute for Healthcare Improvement. So there's this triangle, which is the triangle of the different items for the Triple Aim. Why quadruple has come up? This is a new term that came out this past year. Dr. Bodenheimer out of UCSF had coined this one. Because one of the things, as you can imagine with that slide earlier, depicting everything that we need to do to meet these requirements, it's resulting in a lot of burnout in terms of physicians and staff, in terms of the things they need to do to achieve these goals. And so the health of the provider, which includes the staff and the clinicians, is very important as we roll these things out. This coming year, the government has decided to combine all these programs together and say, you know what, we need to continue to move down this path of providing value-based care. And we've broken it out into these 4 different areas that combines a lot of different quality value initiatives that they want to continue to move forward. So this starts next year. And one thing I do want to highlight is meaningful usage is the 4th item down on the bottom. There was so much negativity in terms of that program that they decided to change the name. But the core content is still the same. But they decided, oh, meaningful use is going away. Well, it is in name, but in terms of practical matters, it's not, because they just changed the name to Advancing Care Information. So when doctors felt like there'd be some relief in terms of the work they need to do, it's really not happening, and there's still additional elements they need to keep track of. And I'm going to talk a little bit about that as we continue to go. And this is a recent publication that just happened, that just came out just a couple weeks ago. And also internal medicine. So in terms of time, and we talked about data veracity, and Dr. Rogers mentioned this a little bit earlier. For every 1 hour of clinical care delivered, 2 additional hours of clerical documentation work occurs. And this is in the office. And then on top of that, An additional 1 to 2 hours of work occur at home. So these are physicians. This is not staff members. These are physicians who are working with these systems that were made to improve care for patients. But at the same time, as you can see here, this shows that, well, there's a consequence to trying to keep track of doing all these different things. And there's obviously an increased risk for physician burnout, lower quality care, and obviously how does it impact documentation for these data sets that people are relying on to make predictive models and do research on. Another thing just to highlight in terms of, well, how did systems get designed as the way they are? So we just need to go back and say, well, how did we get taught in medical school? Medical school, basically you get trained to get a history. So you go to the doctor, they get a full history, and there's a regimented algorithmic way to what you need to ask and what you go through. One of the mantras, they say 90% of the diagnoses come from the history, so you get a very detailed history, which is comprised of all these different items here. Well, the government has decided to move forward with that model, and so billing, people say, oh, these are financial systems. Well, because they built it so that it follows the same question and answer process that occurs in terms of getting that history, and that's what comprises these billing guidelines, which then these EHRs modeled their systems after to try to capture all that information. And speaking to one of them that Dr. Diaz-Rue mentioned about, in terms of the social history, all the different domains, there's a psychosocial, behavioral. Well, in medical school training for social history, it basically is that one area is the behavioral domain, because you'll think about the doctors who you've seen, smoking, drinking, maybe where do you work, and any drugs. Those are the common things, and that's what's been taught in medical school. So I'm going to take a little aside. I didn't mean to talk about this earlier, but her discussion of instituting the newer Institute of Medicine guidelines of getting additional information, that's not even in the mindset of individuals who are taking this information. That's not even in the medical school training at this point. But I highlighted the one area here that data is in different areas, because when you take the history, it can be in different areas of the history-taking component. So, but one could imagine there are benefits of having progress notes that are electronic. So legible, that's obvious. And then there's studies that say they're better quality notes. But at the same time, for people who have worked with this data, there are shortfalls that include note bloat, which is a term that's been coined where notes are cut and pasted, so exact same notes are cut and pasted to another note, and so the quality of it is in question. And single-click templates of everything being normal. I have a slide here that goes into our system where people can enter data in a variety of ways. And we're free text can go in that little box there. They can single click different options, and doctors are just trying to get through the day when they have 15 minutes to get through all of these different items, which obviously they don't because they're spending time at home. So just looking up a definition of data integrity refers to the overall completeness, accuracy, and consistency of data. So I wanted to highlight, the way systems are set up and how that can impact these different areas for that definition. So data input, if you've seen one physician, you've seen one physician. So what I have listed here is an example of different ways to depict someone having heart disease. So it varies based on someone's training back in medical school. They just have to know that there was a heart disease that was in the history and heart failure. So all these different definitions or all these different ways of writing it could be in the history. And that's where with the data analysts that they have to work through these different ways of capturing this to understand that it could be collected in a number of different ways. When we talk about data completeness, this is just an example of our system setup with the data warehouse. We have a number of feeds from different interfaces that we've created. And with that, this is not totally complete. This is what we have today. And every different healthcare organization has a different set of interfaces they have already created. So some are more complete than others. So again, if you're making research or designing research questions, it's important to know what's actually feeding that system that you're querying. And most organizations aren't like a Kaiser Permanente, where everything's integrated in just one solution. The sources come from disparate sources, payers, hospitals, other healthcare systems. And at this point, most of them don't come in. They're still siloed at this point. So again, you don't have a complete data set when you're trying to go ahead and do some data studies. Some studies that came out about data integrity, depending on where or who you are in terms of what information you're looking for. So if you go through claims, for example. So this study in the annals also mentioned that there's a variety or a range of accuracy in terms of the sensitivity of reporting, anywhere for 46 to 98%. We talked about earlier about making policy decisions. So if you're making a policy decision on something on 46% reporting rate, that's probably not ideal. When You're looking at EHR data versus claims, because if the government's going by claims data in terms of how they make some decisions. This study by Tang had talked about just looking at diabetics, and they found that they're looking at claims versus data within residing in the EHR, only identified 75% in claims, and I'll show you an example of how that can be, where it was more accurate when they looked in the EHR directly. So this is an example of a patient in our system, and using some lingo there people probably don't understand at the top, but this is maybe a way a doctor may write a note. We have an 83-year-old with a past medical history of coronary artery disease, atrial fibrillation, mitral regurgitation, status post, which means they had mitral valve regurgitation, diabetic, hypertensive, heart failure with the ejection fraction 44%, urinary incontinence, presents for follow-up. So again, 15-minute visit to go through all this information. So this person's problem list is here and continues to go on. And a summary of this, there's 34 problems listed. This is a real patient in our system who's been in the system for some time. When we say look at claims, Medicare only took 4 diagnoses in the past. Only this past year they take 10. So is that a complete picture? Probably not. And the way the systems work, because as was mentioned earlier, payments are driven now based on the illness of our patients and how we're taking care of them. The diagnoses need to be submitted every year. So an example that's often cited is if someone had a right knee or a right leg amputation a year ago and the claim was submitted. If it wasn't submitted the next year, the Medicare basically says, oh, doesn't have the amputation anymore. That person's healthier than what they think it is. So it's a little frustrating for clinicians and how we work in this environment. And I think the other thing that happens with payers is that for payers themselves, patients jump or could change insurances. And when that happens, it starts from ground zero again for that insurance. So they don't know anything about you. So the data that is rich is within the EHR, but as you can see, there's some challenges with that too. And here's the plan that was written for this patient. So despite the 34 problems, at that point in time, these were the 5, 6 issues that were important at that time. So there's 34 other ones. You may never include all those other diagnoses to submit and claim. So to the insurers, Medicare, they only see a little snapshot of that, and they think that you're only seeing, this type of illness for a patient. And the charge capture process, so this is just an example of, where you pull this information from, and, that can be limited based on, someone remembering to put all the codes in. And there are tools that have been developed to try to increase the ability to capture more information, so there are a number of those out there. And I just wanted to give an example of some of the challenges with this. So Dr. Diaz-Rue, Dr. Rogers had talked about, well, we're moving to a value-based environment and payments are contingent upon the care you're delivering. And now healthcare organizations are now on the health, this Compare website based on, submissions and claims that you submit. So consumers are now looking at this. So obviously the data should be valid or needs to be valid. So in this particular case, there's a measure here that says, a beta blocker type of medicine for someone who had a heart attack before or a history of a heart failure condition, how many people are on that medicine? So some seem simple enough. And how do you find this information? I talked about these codes and claims that get to be submitted. So there's ICD-10 now, used to be ICD-9. Well, that code didn't exist. There is no code for LVEF, which is the ejection fraction 40%. So you're already missing that information. If it doesn't even exist as a code, yet they made this as a measure that's important for us to be measured against. And well, in reality right now, there's an additional code so that you have to put in remember to put in to say, oh, by the way, they have heart disease, but they also have heart failure, and you have to put that extra code in, which goes back to this slide here. You have to remember to click another click. So when the clinicians or people who are remembering to use these systems, to remember that extra click is not really going to happen. And so what happens at the end of the day is that these systems are, for these programs, they are basically posted nationally for people to see. So there is a potential negative impact if it's not fully accurate. So for the organizations working in these environments, there's a risk for poor outcomes falsely attributed just because the information wasn't submitted because the methodology was not smooth or the workflow was not there to support that. And as a result, the healthcare organization may suffer lower reimbursements. Data and predictive analytics, what I have here. So this is not to mean that everything is all negative and there's nothing beneficial with what we're doing with all this information. And a lot of good things have come from this already. So I just want to not say this is all negative, but it is challenging, and here's some of the barriers with that. And what are some exciting things that are happening in the space? So Cleveland Clinic, this was announced a couple of years ago, launching Watson, projecting to new treatment options for cancer patients. So taking that data that's in there with its limitations, but potentially offering some treatment options based on the data they have there. What are the things to try to improve, or how do we move forward in terms of the data research perspective? Basically understanding that data sources and the methods of data entry, just as I mentioned earlier, so that there are inherent challenges the way things are designed today. Maybe looking at how we need to change the system so that it's better designed to better capture information without that extra work that needs to occur. And less focus, this is the government's trying to make inroads to this, focus on programs that don't necessarily improve quality, so not to focus on those and change things from that perspective. Other sources of data and future applications. So the data that's coming now is we're still early in the phases of this. Healthcare exchanges are now developing, becoming more mature about that interoperability between systems. Not all the data is complete from that perspective. In terms of the privacy and confidentiality aspect of this, we have to get consent for patients, and some patients may not consent because they're concerned about sensitive health conditions and these other issues that they don't want to share. So when we talk about completeness of data, there could be gaps in there. Precision medicine, when you add genomics, a whole other area in terms of, okay, what can we share with other groups? And in terms of the artificial intelligence, where I write that there's still exciting opportunities and potential. Like the fact that we are electronic, we're definitely better than we were before, despite all the complaints that I still receive. But I think there's still a lot of exciting things that we can develop in the future. But just to give you a sense of some of the challenges that are facing that data that's being inputted and why it's a challenge. Thank you.
Okay, my name is Kilian. I'm with the Center for Internet and Human Rights in Berlin, Germany, and I'm very grateful for the opportunity to speak here today. Can everybody hear me? If I'm not making sense or you cannot understand me because of my accent, whatever, please let me know, so I will try to clarify. I haven't done this 100 times before, especially not in English, but I'm very happy to be here for this opportunity to speak to you. And what I want to do is essentially two things. First, because we were asked to provide a little bit of a European perspective on big data, and we'll try to do that and clarify our approach and how we see this. And second of all, I want to give an example from security, from national security, on how big data works there. Just very shortly about the Center for Internet and Human Rights. We are a research center with three main research areas that you can see here. First is technology and international relations. Here we study how digital technology shapes global politics and foreign policy. There's a lot of talk about cyber foreign policy and stuff like that. Here we have a research project at the moment that's called Internet Policy in Eastern Partnership Countries. Those are the countries east of the European Union, and so we study how the EU refers to those countries. Second research area is norms embedded in technology. That's the area like big data and ethics of algorithms belongs to as well. It's about how norms define technology, but also how technology defines our norms. So it's not a one-way street to interact, and as we interact with the technology, we form it, but it also forms us. So that's the basic assumption we're following here. And just to complete this, the third research area, digital trade and development, that is, for example, a study on export controls of surveillance technology. It's like a new area where new kinds of regulations have to be thought of and studied, how you can, for example, regulate dual-use technology that is exported. So, but that's all I want to say about the center as itself, just to introduce myself. The research project I'm basing my talk on is what's called ethics of algorithms. So we get funding from the Dutch government to think about how, what algorithms are of public concern to us. What is the relevant parts of algorithms that we need to study and that public policy needs to address. So we view this whole big data issue as an ethics of algorithms issue. And when we published a report on this, we said, okay, which are the algorithms that raise ethical concerns? And we came up with these like 3 broad categories that are relevant maybe to regulation of algorithms. First of all, algorithms that keep information away from us. So they act as gatekeepers. Just think of the Facebook algorithms, Google's PageRank, all those kind of algorithms that control what kind of information we have access to. That might have impact on freedom of speech, and on voting rights. There's been studies how what you see in your newsfeed might impact who you vote for, stuff like that. Second is algorithms that make increasingly subjective decisions. So algorithms that don't answer simple yes or no questions, but questions like, who should I hire? Who should I date? Who should I, what should I see in my newsfeed? Those kind of decisions where there's no clear-cut yes or no answer. And thirdly, the opaqueness of many algorithms. So we often don't know how they work. Certainly the public doesn't know how they work if they are proprietary algorithms. And it's important to Google's business model that nobody knows how the algorithm works. But even the owners of the algorithms themselves sometimes are not 100% sure how they work. There was, in one article, a Facebook engineer said they tweak their algorithm 10 times a week. So they might have trouble themselves predicting the outcome. And there's also a lot of machine learning now that you only set the first baseline, and then the algorithms goes on with the data it finds. And so that also might have outcomes that you did not expect. Second reason why we approach this from an algorithms perspective is that we see algorithms as condensed technology. So if you want to study technology, well, if I put this too close, I sound like a Terminator, right? Is that better? No, so I keep it down here. So algorithms are condensed technology in the sense that we have vast IT systems and computing systems around us, and they all run on software, but the very essential part of the software is the algorithm. And just to give a broad definition of what an algorithm actually is usually compared to a recipe. So you have a certain set of instructions that is followed one by one, like you follow instructions if you bake a cake or something. So my whole point with this is that big data is essentially a question of ethics of algorithms. And I want to go on a little bit more about why we think the algorithm side of the story is important. But first of all, I want to give a short definition of big data because I want to trying to be very academic, so you have to start with a definition. And I found one, actually not a European one. It's from Kate Crawford and Dana Boyd, who defined big data in a way that I like it a lot. First part is big data is about technology. So it's about the maximizing computation power to gather, link, and compare data. So the technology part is very, very essential. And then there's the analysis part. So you have a lot of data, but you need to draw on those large data sets to identify patterns. The data itself doesn't tell you much. So you have to look for patterns in the data. And then the third point they emphasize, which is not very common in most definitions, is the mythology. They call it the mythology of big data. That is the belief that those large data sets offer a higher form of knowledge that can generate insights that were previously impossible. So this aura of objectivity and of a better kind of knowledge that you can generate from large data sets. And I found that interesting because they are one of the few that point out this cultural dimension of big data and of the discourse about the big data. And what is also interesting that what seems to be taken for granted in this definition is large data sets. So all the 3 points were based on, we have large data sets. And we work on the assumption that that is the given now. The large data sets and the amount of data available developing through the digitization will continue to grow. So we will have increasing amounts of data on and on. There's probably no way how to reduce data. Yeah, we're all having little data collectors in our pockets. There's no way we will return or like change this trend anytime soon. So yeah, that's why that's another point why we wanted to focus on ethics of algorithms, of the sense-making parts of the story. And I now want to go on to the security example that I want to present. Because one field that hasn't come up so much yet, the discussant in the last panel briefly talked about it, and I also want to touch upon it, that we have a security, I'm talking about security policy, I mean security and national security, defense, and so on, that we have a risk-based logic of security that is anticipatory, and that has been around for a while, but it's coming to a new level based on big data. So back in the day, you used to have threats, the friend and foe dichotomy, where you were protecting yourself from this outside threat. And this is more and more shifting towards we're calculating risks that we want to prevent or even anticipate. So prevention is one part, but the anticipation of the risk starts even earlier. So what is risk in security? For some of you, risk, if you're just in statistics, risk is just another word for probability, but if you're talking about security, it's usually defined as the potential damage that may occur times the probability of its occurrence. And what is defined as a risk is essentially a question of perspective. Everything can potentially be a risk, and not all risks that we face are interpreted as dangerous. And to capture this idea, I want to cite the French sociologist Didier Bigot, who came up with the concept of insecuritization to capture this phenomenon. And I want to go on what that means just now. Because if you approach security as a risk management, then you move from prevention to preemption, and you have to define who is at risk and who is the risky population. So you have to draw new lines to make sure who you secure and who is the threat to the secured populations. So what you're essentially doing is you're drawing new boundaries between different populations, different groups. That's the idea of insecuritization, that you secure one group, but another group is insecure at the same time. David Lyon calls this social sorting. So you group people and you differentiate between those, and that makes permanent monitoring necessary. And the second logic that this makes necessary is to collect all data, to collect as much data as you possibly can. Because everything might be relevant if you're calculating a risk. You don't, because you're acting preemptively, you don't know what's going to be relevant. And this categorization of people that happens in securitization goes from the individual threat. So you used to have like an individual threat or danger occurring to types of people that might be dangerous. So yeah, best captured in the sentence on the bottom, that you separate the risky from the at risk. That's probably the nicest way to explain it. So if that doesn't make any sense right now, let me try to give you some examples. Think about, for example, predictive policing that has been really growing in the US, but also starting off in Europe. You define certain areas where you have to police, but you're also changing the anticipating things, and that might be a self-fulfilling prophecy. You also see it in border security, the ones that go through border just like that, the other ones that have to wait in line, especially prevalent in the current European refugee policy. And then the intelligence-based airstrikes that have already been mentioned. All those are examples of preemptive security policy. But there is a lot of ethical and human rights-based concerns about that, because if you have been mentioning Minority Report, it's almost like that, because if you can be, if somebody's acting upon you on the anticipation that you will do something, then there's not really a rule of law and due process possible anymore. And also there's a lot of privacy invasion and discrimination that can happen through these, but we have heard about that before. So the essential takeaway here is that algorithms and security algorithms, in my example, are not ethically neutral. So they're not more, that relates to the mythology part of the definition of big data, they're not more objective or more true. Yeah, to sum this up, big data does not speak for itself. There's no such thing as raw data. You're always making sense of it in some way. And theories and models are still needed to make sense. If we just act upon the data without predefining our theories, we're even more likely to run into false assumptions. And that goes hand in hand with making assumptions and methods explicit when you deal with big data. That is like the most important way to overcome biases and unintended discrimination. And there's practice and discourse-based approaches, but I don't want to go into detail about that just now. And then the security part. If you base your security policy on risk, then you pretty much abandon causality, because you're only looking for correlations in the data about where a crime might occur. And it's not just about crime. The risk-based approach is really spreading also to other areas like pandemics, climate change, poverty, all kinds of areas. So we have to be careful not to depoliticize data in performing our security and in producing security. And last but not least, government regulates through algorithms, and that means we have to regulate the algorithms. So if the government is using it, we have to keep checks and balances on it in order not to let them gain too much control. Yeah, that's all for now, and thanks a lot for your attention.
I think many of you in the room know Kevin, and he's at the National Academies. Kevin can speak about just about anything, so I'm really looking forward to his presentation and his summing up of the presenters that you just heard.
I think the light needs to be green.
Yeah, that's why.
Do we get a green light? There we go.
Okay, these are very disparate presentations, so it's very hard to talk about them as a group. Though as I listened to them, I was reminded of a Borges story, the Argentine writer, it's a one-paragraph story on the exactitude of science, and it's the story of a country where there were devoted to map making. And they realized that in order to have the perfect map, it got more and more detailed and complicated. So finally, the map was the same size as the country. And then others says, well, this is silly, and they just left it out in the rain, and it dissolved and was forgotten about. So we have this problem, as everybody is talking about, that there's tremendous amount of data becoming available. And I was trying to think about one question that each of you might try to address, and that is just when we think about all of these things, all these uses of data, we always think about, we sort of set the standard. What's perfect? What are the problems with it? And we say, well, it's going to be used for this purpose, predicting protests, which can be, in some cases, a good thing. Maybe it's isolating terrorists or identifying terrorists before they act. But in all cases, are we ever doing anything that we're not doing already by very sloppy means, like using spies, asking our friends what to do, making medical diagnoses with limited amount of information, trying to control security threats and so on with just hearsay and half information. So I just wonder, in each of your cases, as you look at the application of data to the various things that you raised, where is the starting point? And in some ways, this is the discussion about the driverless car or about democracy. Democracy is the worst system of government we have, except for all the other ones. Driverless cars are going to have accidents, or people are going to die in cars. They're just safer than the drivers we have. So our algorithms are driverless systems in medicine, security, and so on, going to be safer or less safe than the half-assed methods that we use right now to do the same things. So, you're each going to have to take a turn.
I was hoping to buy some time. Think about this. So, I think that's a very insightful question. Whether are we doing anything that we couldn't do through other means? Maybe slower, maybe costlier in other ways. But I think it's important to see that data is often just a surrogate for something that you're really measuring or tracking or modeling, right? So what has really attracted people to this whole field of big data is that things that were never digitized, things that were never recorded, things that people never thought of connecting or correlating have now become extremely easily available, right? So and through that opens up a lot of new possibilities, right? So I'll give you a good example from my own project. We were trying to model disease outbreaks. And so how do you model diseases, right? So you typically model it using news reports of disease outbreaks. You can model it using search queries that people are typing on Google or something. But we hit upon a lot of unconventional data sources. So for instance, there's this website called OpenTable. I don't know how many of you are familiar with this. It's a website where you can go and make reservations to restaurants. And that data is open. Anybody can download that data. And if you look at the number of reservations and cancellations that people are making over a period of time, that gives you an advanced indication of a health outbreak, right? So there are sort of unconventional uses of data that emerge, right? So in fact, one of the things that in computer science we talk about, we have this famous paper that's titled "The Unreasonable Effectiveness of Data." Okay, and what that means is there are problems that you would solve in more complicated traditional ways, but data actually makes them very easy. Like for example, if you go to Google and you type a word, it does a spell check for you. It tells you, did you mean this? And you know how it does that? It doesn't do it by consulting a dictionary. It does it simply by the people who have first typed that query and then later on realized their mistake and then typed the second query. Right? So that's an example where just looking at data makes you behave like a spell checker. Right? So the question about does data make things easier or something? I think it certainly opens up the scope of problems that you can solve. And of course, it brings with it all these issues. So I don't know if there is a. So I guess your question is more: could we have gotten to this place in a different route, right? Could we have done this differently? And I think that opens up maybe other issues that we should discuss.
Yeah. So I guess in the space, as I was hoping not to be overly negative, but I think that there are challenges in the input process. But if anything, it's the great big hope. I think with going electronic, that the next step of where we're going with this process and where we're going to is worth it. Today, in terms of time for diagnoses, so do we need to be electronic to do this? No, it's still the mental brain, and you're collecting all that data that I showed before. And making that mental decision. But what we're allowing the capability of by going electronic is probably the immediacy of getting information. So hopefully delaying the delay in diagnoses, because now you're communicating a little bit more timely. Now, if paper processes more efficient, then maybe you wouldn't need if people fax when they're supposed to fax and they document when they're supposed to. But I think as it stands today, we're not quite there yet. I think some areas we are. It's introduced other areas. One area that we looked at is like malpractices, so malpractice rates. So now we've gone electronic. Have we seen a decrease? What's the outcome or benefit from this? Were there decreased rates of malpractice suits because of the implementation of this? So there weren't cases related to delayed diagnoses. It's still too early. So I think it's more the great hope that we have by going electronic, and maybe talking later about how to predict someone who's going to develop cancer, for example, with this data, which we couldn't do before in this more population-based way. So I think it's kind of a gray answer to that.
Just a quick follow-up. I think I can speak loudly enough for everybody here. When you talked about it, you said in most cases, most of us aren't working at Kaiser Permanente. We've got a mess of data from a variety of sources. It's hard to put together, and it's just noise and not information. Is a system like Kaiser, where it is controlled and internal, are they getting it right? I mean, is that a suggestion that if we were all members of Kaiser, we would be actually getting better quality and more efficient healthcare? Or do you think even Kaiser is not getting it right?
Yeah, so I may have been putting them too high of a pedestal, because there's still challenges, because you're inundated with a lot of information despite being in one unit. So I use that as a model, because no one else, there's like maybe 3 organizations like that throughout the country, really. And so are they perfect? I think they're better, I think, in some of the metrics that I've seen. But it's still not the perfect model, but even though I cited that, but there's still challenges with that data. But I think that with newer systems as they get developed, because this is like version 1.0, as we move forward with that, we will hopefully see improvement in collecting that data and presenting in such a way so that it is more useful for the clinician or whoever the care team that's now involved in the care of the patient.
Back to the question, is it any new what we're talking about here, or is it just a technological continuation of what we have always done? I guess to some extent, always yes. So we just go on doing have the same principles, but the technology part we see new things and different things. So it changes the perspective a little bit, I think, and it makes certain things more powerful. So you have to make sure that certain safeguards and are also becoming more powerful, keeping up with the development. But as I said in the beginning, it's not a one-way street. We are defining technology, and it's defining us, and so we have all the means at our hand to do it and to change it.
Well, I did want to follow up with you, because this is a perennial debate in science and technology policy, is whether as new technologies evolve, do they have embedded ideologies, essentially? And that's a question with this. Are we just extending what we're doing, or does it change the nature of the question because we're able to get so much information and without people knowing about it? So, is Facebook worse than the Stasi? Or something. I mean, really, is it? And this is a debate that differs in the United States and Europe. Europeans, I think, are more likely to see embedded ideology in the technology. So I wonder, in this case, to what extent do you think that is? I mean, because I think you're the one who's likely to take the hardest line on this. So follow up.
Yeah, well, Yeah, yeah, I think that's true. We tend to see like the embedded ideology in things a little more, and it's for maybe it is for historical experiences. That's also possible. You know, the American story is always getting a little better. It's and I just coming from Germany, I cannot tell you that story. So maybe that is part of the answer. Yeah, but. Facebook is by no means worse than the Stasi. It's like that. That is a comparison I would not make, because that is just two different things. One government and a company. But does Facebook have? Yeah, but does Facebook have a different responsibility than a TV channel or a newspaper? It's not just another medium that we created, but it's a much more powerful company that is not just watching you from the outside, but rather from the inside. And so, yeah, there is new challenges, and they also, to some extent, come with a discourse about it. So it's not just in the technology ad itself, but as we perceive it, as we frame it in when we talk about big data. So it's more of this perceived objectivity, and that is a risk in that context.
Just quick, I want to go back. I want to open it. What time is it? So much time do we have? Because I want everybody else to get in on this too. Okay, so I can do one more quick round of questions. Just, Dr. Ramakrishnan, you were talking specifically about looking at developments in Latin America, looking for signs of protest in particular. And this is curious. In some cases, we would have looked, say, at the development of the Arab Spring, and this is protest that we would be rooting for. In other cases, 1979 in Iran, we might have expressed a lot of alarm at what was happening. In some cases, we were organizing the protests, as we did in Chile when we were trying to get rid of Salvador Allende. So how does the presence and existence of this technology change what we do? Is it really always about how we use it, or is there something inherently dangerous or risky about using this technology for this purpose?
Who?
It's just an easy question. Is it yes or no?
Well, for full disclosure, we didn't organize any protests or participate or steer or promote them. But I think there are many. I mean, if you think about where this technology fits in the modern landscape, right? I mean, I'll tell you how the intelligence community views it, and that may or may not answer your question, right? So they view it as so they have this different types of int, as they call it, right? So SIGINT is signals intelligence, HUMINT is human intelligence, and so all the work that I described falls under this thing called OSINT, which is open source intelligence, right? So it's not intended to be a substitute for other types of intelligence or information gathering or something. But the fact that everybody is online now, right? All of us are information producers as much as information consumers, right? I mean, if you just look at all the trails that you leave today, you actually can have a lot of data just about yourself, what you do today, and so on. So given that there is all this data, what does that data reveal about these societal events, right? And sometimes they say the opposite things, right? So I know of cases where I go and present this to an analyst, and they'll say, well, that doesn't make any sense to me at all. I've been studying this region for 20 years, and I know what I'm doing, and what you're saying is gibberish, right? Mm-hmm. And so that happens as well. But there are others who are strong believers in it, right? Others who believe that these newfound media might actually short circuit or circumvent delays, in traditional ways of gathering, and then they view this as a substitute for that. So I don't know if that addresses your question, but I think what you asked is something again more fundamental, where where does this fit in? How will somebody use this? I actually don't know. This was a nice research project that began at Virginia Tech and ended at Virginia Tech. Most of the time, you don't know what happens to these technologies after you're published some papers about them.
Yeah. Well, just to pass that over to Dr. Vieth then, because you talked about the way algorithms are making decisions for us on dating, hiring, and so on. But we all know we're being directed by these things. We all know that Google's doing it. So to what extent is that the problem with the technology or the problem with the user? I mean, in the case of security, you can override it. If you're getting a certain amount of information and your algorithms are leading you in ways that you think are wrong, then you can always override that. So when we look at it, how much of this is a problem of how we understand the technology and how much of it is inherent in the technology itself?
I think the bigger part is in ourselves, not in the technology. It's about how, because do we really know how much Google is tipping us and
right, as the New York Times editors and the Wall Street Journal editors have been tipping us one way or another for centuries.
It's more in us and how we see it and how we react to it than in the technology itself, I'd say. But the technology, I stick with that point, has become more powerful than just like what Google does is more powerful than what the New York Times editor does in terms of nudging. So technology has increased and has become more powerful in that regard. But it's all up to us. There's still ways to react to technology differently, but that's also one point that you really have to, when we're talking about Facebook, etc., increase or improve media literacy is an important point when it comes to that. So you just have to adjust to the new ways of how you receive media.
Okay. And last question for Dr. Chow. As you talk about the note bloat that's taking place, and the different, if we see value in electronic health record and improving it, and you say we're in a kind of learning phase now where it might become less efficient or a burden to providing care. How do we proceed in a way that doesn't have physicians say, enough already, I'm just not going to implement this because it's just making it impossible for me to do my job? Is there a way to go about this so that we take advantage of what's useful in the health record, but don't make it such a burden during this learning stage that we reject it altogether?
Right. So I think that will require more of a unified front in terms of how people communicate with the policymakers, and they are listening to that effect. Where some of these guidelines that I mentioned that are coming down the pike, they've delayed some of them. Hearing the feedback from medical groups saying some of the challenges that are occurring. So Dr. Diaz-Rue mentioned they had those stage 3 meaningful use items that they put on the list, but that didn't make the list because of, as you can see, there's already this much work that has to be done. So I think this just the lobbying to ensure people are aware of that, so they are being a little more mindful of the work that needs to be done. And hopefully one of the things I mentioned about some of the changes, because billing is driven based on how things are documented. If they change that methodology of getting paid, that's another way to try to address what needs to be documented or not, which then becomes this note bloat.
Okay, let's open it up now to questions from others, and I'll hand it over to Kate.
Thank you very much. As I said, Kevin can really talk about just about anything, and thank you very much for your insightful answers. So we have about 10 minutes left. I'm the timekeeper, and I'd love to take questions from the floor. Okay. Please state your name. And
Hugh Gustafson, George Washington University, and I was interested in your comments about the ethics of the algorithms, and particularly the do not fly lists, which have been controversial in the United States. It turns out that no one really understands the algorithms by which you end up on a do not fly list. It's clear that some people on those lists shouldn't be on the list, and it's very hard to contest your status once you're on the list. There doesn't seem to be an institutionalized procedure provided by the government so that you can get off the list, that you can appeal your status on it. Could you say, first of all, does any European country have a do not fly list? Do you think there should be institutionalized procedures for contesting your status, for contesting the way the algorithm behaved?
I'm not aware if any European countries have have no fly lists. Germany, I think, does not. But I could imagine that France and UK do because they're closer to the to this approach, I think. And it certainly would be a constitutional problem or constitutional issues in Germany coming up with a no-fly list, because there must be some due process to get off this list, and there has to be clear categories and clear procedure how to get on it. And I've heard about a number of cases where people ended up there and couldn't tell why, and also the agencies couldn't tell why. It's the same for getting your assets frozen or stuff like that. Also happens to people that that cannot tell why or what they had done wrong. So that's clearly a huge problem that is pretty much outside of the rule of law, because if you're abroad, if it happens to you, if you're not a member of a citizen of the country, there's no way how you can go against it, so I was happy not to be on a list, so I could come here, and yeah, there certainly must be safeguards and procedures for that to override that, and so transparency, one way, I talked a little bit about regulation of those algorithm-based decisions, but transparency is also another huge issue. At least if you're making those decisions, be as transparent as you can about what kind of evidence you base them on.
Thank you.
Hi, my name is Jake Williams from Drexel University, and this question is for Dr. Ramakrishnan. Oh yeah, it is on, is it not? Yeah, sorry. And my question is with regards to the potential beneficiaries of the EMBERS program, and this might have to do with the framing of the OSI. But as the way you mentioned it, it sounded like the main benefits to an individual would be, say, something like a travel alert. But I almost wonder if the nature of what you're trying to forecast, being protest activity, necessarily sort of creates who the beneficiaries might be. Whereas if you were trying to forecast the existence of a state action that is not necessarily good for a population, that would then change the list of beneficiaries.
Yeah, definitely. So it depends on when we use the word protest, we tend to have a specific meaning for it. I mean, if you think about it, there's always a protest happening somewhere across the street, right here, right? And most of these are peaceful protests. Nothing major happens. They won't make the newspapers, right? They certainly won't make the New York Times with this. So the beneficiaries. So there are legitimate beneficiaries. So for example, I know for a fact that the State Department consumes our alerts, and they issue travel alerts, and that's really where it goes into. They issue these advisories, and they upgrade these advisories. They say that okay, this region is now getting warmer or not, and so on. But in terms of some of the larger cases that you're talking about, right? So those events are truly rare events, right? I mean, they don't happen very frequently. They happen, once every several years in particular regions of the world, and they would definitely dictate who the end consumers are. But again, there are a lot of non-governmental consumers to this data. Right? So if you're Pepsi, and Pepsi has a big presence in a particular country, then knowing that is of great importance to you. Right? So information about modeling society stability and so on. I can tell you that there are a lot of players who would just like to know the protest, not so much participate in it or kindle it or something, or even stop it. But then the potential for the potential for misuse is pretty high, right? So last year there was an announcement that the Russian government was trying to do something like this. And I started getting a lot of emails from my sponsor saying, "Are you working with the Russians?" And I had to say, "No, I'm not." But there are lots of other types of reasons, for example, where you would like to do this. So, for example, we have applied some of our algorithms in China. Okay, and in China, you might very well make a prediction, and the protest might very well happen, but you will never come to know of it, given the censorship that happens in the media there. So, so you would actually you can think of these open source data feeds as providing you sort of a neutral perspective about what is happening in a particular country, right? China, and these things will provide you a completely alternate perspective there. So anyway, that's so I know I'm not getting into too much specifics, but that's as much as I can say.
Okay, thanks. One of the things, there's both a comment and a question about electronic health records, is that they've so fundamentally changed the relationship between doctor and patient, because doctors are usually asking questions and looking at the screen and typing in the answers during that, doctor-patient interaction. So I'm interested in whether you know of any efforts to sort of develop either new systems or new features to existing systems that are more both doctor and patient friendly.
Yeah, so there's a variety of educational methods that have been in development, because this is still relatively early. So even medical school curriculum, they are now, like University of Arizona, they conducted basically a session with students. So again, starting early, that they have sessions with the patient and how they mock that, and they record how the interaction occurs, because technically you can have that personal physician-patient interaction and how you arrange the rooms, so that the exam bed's behind you, and then you have your back, and then you lose that connection if you put the patient next to you. So there's a movement towards that direction, but it's not uniform across institutions, because not everyone has a simulation center. And those are new things that are developing, and I think the emphasis of ensuring that that does occur hasn't been uniform across all the medical schools in the country. And then on the other side, you have physicians who have never used computers, don't know how to type. So then they may be doing this other way because they're so strained and stressed on just getting the data in to meet these other requirements, then that forces this other type of dynamic that they lose out on that physician-patient interaction. So I think, as you may have heard, is people towards the retirement age, that may force people to leave earlier than they wanted to, which is, a drain in that aspect of it. But the newer generation are more accustomed to this, and I think maybe that's a benefit, but that's a huge gap that you wouldn't want to have to deal with, that you miss all this experience for that other side.
It's also almost hard to get the counterfactual for, the benefits of the electronic health medical, records, which are very large, but it's hard to measure what you lose.
Right, yeah.
Yeah.
So I'm Sally Keller from Virginia Tech. This is really more of a comment on the last interchange. And one of the big problems that we have with the electronic health record enterprise, if you will, is that we haven't seen the vendors yet starting to open up their APIs and make things a lot more interoperable, which has not allowed for a great entrepreneurial space for the development of interfaces that would be much more friendly to the physicians and allow for better communication. And I think we're beginning to see some of this, and we're hopeful that perhaps in Meaningful Use 3, Stage 3, there'll be some further requirements placed on the vendors for having more interoperable and open APIs, so that we would see our students, for example, starting to develop really useful interfaces so that you don't have 100,000 drop-down menus to record 34 things. I mean, I'm just curious in the room, how many of your students actually that do entrepreneurial things have tried to develop any application based on an electronic health record system? I could ask you about many other areas and half the hands in the room would go up. So this is a problem, but hopefully it's a problem we'll see fixed, and hopefully it's a problem we'll see improve that interchange.
Any last statements from the panel? Okay. Thank you very much, Dr. We have a break for about 15 minutes. Please, if you have extra questions,
and it'll go green. That means you're live.
Okay.
Just don't.
Especially when you got lots going on. Okay, we think it's time for us to gather again. We want to make sure everybody has plenty of time to share their thoughts. We've got just such wonderful speakers, and there's more time yet again to talk over a reception, so you'll be able to continue your conversations. So with no further ado, I'm going to turn it over to Adam Eckert, who will continue in the vein of excellent introductions and timekeeping.
I promise to do neither one of those things. So for this panel, we're going to be talking about conceptualizing privacy. And the papers, as you'll see, are going to walk us through understanding what the privacy issues are in data. And to kick it off, I want to start with a couple of thoughts. Just because I'm the session chair and I have a prerogative to do so. So I want to talk a little bit about some rhetorical questions thinking through. I mean, one of the first kind of obvious questions is who owns the data? So we are collecting these large-scale data sets, and the question of ownership becomes really important. And this is not, I want to conceive this as a little bit differently, because we tend to think of this who owns the data. We tend to think of the individual level. Like if I provide information, we conceive that an individual has provided information, and that information has been given to another party. But what about community level data? Who owns community level data? Does the community retain ownership of that, or do they cede ownership of that to the Census Bureau, for example? And what does it mean for a community to have ownership of data? Who owns aggregate data? Who can use data? And who is able to have access to the data and use it? And what are the responsibilities in doing so? How is ownership transferred? We on an individual level, we can conceive of the informed consent. And I'm sure you've all heard the recent study that found that people were willing to give up their firstborn child in a consent form that they didn't actually read. So what does that mean for informed consent? And then what does it mean for a community to give consent? Because whenever I give information about myself, when I give up my data, I know that those data are going to be used to define parts of me. But the definition is never going to be fully comprehensive of me. So what does that mean then at the community level? Because the communities are going to be defined by the data about that community. And I'm sure that a community that is defined as low socioeconomic status is not going to like that definition. So how is the retention of ownership of those data assured? And I'm sure Etta is tired of hearing me say this, but the data are always going to be limited. We know the data are limited. Whether we have 10 metrics about a community or 1,000 metrics about a community, we don't know everything about that community. But we're going to use those data to make policy decisions. And as we make those policy decisions, what is our responsibility as the users of data, the policymakers, the people who do the research, to ensure the privacy of those people and communities? So these are just a couple of things to think about, as we're conceptualizing what privacy means in terms of data, is conceiving it, yes, at the individual level, and about that ownership of individual level data and how that ownership is transferred, but also at the more aggregate levels. Who owns aggregate data, and how is ownership of those aggregate data transferred? So with that, I want to introduce the panel so we can get into these questions a little bit. First, we will have, oops, wrong page. First, we will have Meg Lita Jones, who's an assistant professor in communication, culture, and technology at Georgetown University. We will then hear from Michael Planty, who's deputy director with the Bureau of Justice Statistics. We'll then hear from Sally Keller, who is a professor of statistics and director of the Social and Decision Analytics Laboratory here at Virginia Tech. And then finally, Kelly Moore will provide us, will be our discussant. So with that, I'll turn it to Meg.
Thanks, Adam, and thank you very much to our organizers for inviting me into this lovely space, I don't think anyone's going to have a problem understanding any part of this presentation. I'm going to ask you guys to all be data subjects. I know most of us are data scientists of some kind, but for the next 20 minutes, I want you to remember that you're also a data subject. So we're supposed to be talking about conceptualizations of privacy, and I'm going to talk about this in terms of reconceptualizations of privacy and talk a little bit about some recent transitions. So right now, as data subjects, we live in a world where notice and consent is how data is handed off and exchanged. Notice is provided in a privacy policy somewhere, and the idea is that you provide consent by choosing to engage in that information system. So as data controllers and data collectors, we think, oh, these privacy policies should have really detailed language about what comes in, what comes out, who's being traded, how is it being used, or maybe they just use one of these many free privacy policy generators that exists on the internet where you just plug in your company dumps out a generic privacy policy. This is pretty indicative of the problems with privacy policies in general, and everyone in this room knows the problems inherent with notice and consent in the digital age. Nobody could read all of those policies. Anybody that has a computer up, I'm guessing, has a number of tabs. Right now they're consenting to a lot of data collection privacy policies you've not read. You couldn't read them. Even if you did, you probably wouldn't understand them. Even if you did read and understand them, it's still very hard to make a good decision, a good choice about future uses that you may not understand and may come up later. And sometimes there is no other choice. So in the 70s, most people in this room also probably know about fair information practices principles, and these have this idea of FIPS has expanded outside of the health arena where it started into most data regulations and guidances are based on the FIPS. And you'll notice that transparency and choice are still prominent within FIPS. So notice and choice are still really important in these kind of use restrictions. Here's how you should use data so you don't accidentally give away your firstborn child. That should be at the bottom here. Also, don't give away your firstborn child. There is no limitation on what your privacy policy can and should say in FIPS. This is not like a restriction on contracting with your user. But an important addition to FIPS is participation. And we want to give data subjects participation in their data. They should be able to access it, not only know up front, but be able to find out later what was collected and correct it if it's wrong. In Europe, there are more participation rights in the data protection regulation, like the right to be forgotten, the right to delete. In the US, we don't see that language very often. We see more of a right to correction or email us at this site if you want to talk to somebody about your data. And then we have these ideas about security and accountability, which I'm not going to talk about. So notice and consent and control pretty much brings us up to speed on how we've conceptualized the effectuation of privacy to this point in the last 50 or so years. But I want to talk about the near future and the problem with relying on the privacy policy in a world where there are no screens or there are far fewer screens. Somebody brought up the doctor looking at the screens earlier. We engage our world through screens. People have their computers and their smartphones, and that's how we enter our information systems. But that's increasingly less true. So in this smart future, we have smart people. We have lots and lots of wearables. I'm sure some of you are wearing them now that are taking in really interesting forms of data and sending them off. We have smart objects that fill different spaces and smart environments. And this is smart city initiatives, things like that. And so this creates this smart future that this is in no way a stretch of the imagination. Everything I'm going to talk about exists today. So One of the problems with this smart future is that there's no screen. And so you can't find that notice and give consent or make a serious choice. But it's also not your stuff. A lot of times it's not your stuff. So your Apple Watch is yours. But if we walked out the door and there were drones above, they're not your drones. You didn't set them. You have no idea who they belong to. You don't know what information they collect. You don't know if they are mapping faces, if they're pulling information from cell phones. And there's no way to tell. There's no identification. You don't even know whose it is to call and say, hey, by the way, I'd like to participate in my data that you've collected. And I think that increasingly we're going to see these from a flood of different objects. And so I refer to this problem as the Internet of Other People's Things. But what's important about the Internet of Other People's Things is that it fundamentally breaks down the even the theoretical idea of notice and consent. It's off the table completely, which is really exciting because notice and consent wasn't working anyways. So it's this great opportunity to really think about how we can reconceptualize privacy and giving people some type of agency in their information moving forward. And so just to look at a few of these, this is the new smart fridge. I'm sure you've seen the commercials with Kristen Bell and Dax, her husband, being adorable with their smart fridge. The one above that is a lobby that uses facial recognition instead of fobs to allow people in, and you don't stop at the front desk. If you're a visitor, you're just flagged as a visitor, and as you move around the building, you're tracked. The quadcopter to the right is just your standard recreational drone. There's an image of Google Glass below that, which has pretty much fallen off right in time for Snap, which was Snapchat 5 seconds ago, is now making Snap spectacles that they're awesome. They look great, and they have little recording windows at the corner of each lens, and they take in video and images. So not the same type of augmented reality that Google Glass was going for, but very, very wearable, and they take in a lot of at least image data. Below that's the smart car. The image to the right of that is one of the an image from a retail store using the hotspot trackers, and so tracking people as they move around traditional retail spaces. And then the kids up there are using smart watches that track kids using GPS, and a handful of other smart environments to the right. So this is the future that we're sort of dabbling with now. And to bring all of this home, I'm going to talk about a very particular affordable object that we did some research on, Hello Barbie. And I had embedded this video, and it wasn't working, and I don't know that it will, and I don't think it's going to. So I'm just going to do a little descriptor of Hello Barbie and bring her out to show you. So Hello Barbie is a smart toy made by Mattel. She uses a Wi-Fi connection and voice recognition software to have a conversation with children. And she, I think, is the perfect object to explain some of the pitfalls and how we really need to start reconceptualizing privacy today. So you go to the store and you buy your Hello Barbie and you get some notices. First, you know that Hello Barbie is your best friend. That's an important thing to start with. So she's a friend. She's your best friend and she wants to talk to you. I put her back in the box upside down. But on the back, you do have some disclaimers. So this is a description. Press her belt, talk to her. She answers you. But then down here it says that you have to download this app and you have to give consent. So let's look at how that works. So if you did buy this, you would know, if you read the fine print on the box, you would know that she doesn't work unless you sign into all of this system that we're going to take a look at. So we get Hello Barbie home, and we're charging her. She's connecting to the Wi-Fi, and we go and we download the Toy Talk app. Toy Talk is the software company that Mattel partnered with to run this voice recognition interaction. And you go into Toy Talk, you put your email in, they send you an email, your email pops up. Great, so notice we've very quickly moved to a screen. We've gone from one screen to another screen. We get this email, and you click the big orange button. I give permission. Below that are the details, of course, of what's actually happening. And in that, you'll see this is a long email. So this is a single email, and you'll see on the right there the kind of information you get in the policy. You actually have to click on another link that takes you to the privacy policy that weirdly looks like this. I don't know why, but this is what the privacy policy page looks like. So then you click another link. There's no video here. This is no way informs you about privacy. So you finally click through all of this, and you could get to the privacy. You could get to the privacy policy if you so dared. When you get into it, this completely complies with COPA, the Child's Online Privacy Protection Act. Nothing about this is illegal, right? So we're talking about ethics today, and so we will not talk that much about law. Now, when you get into the parent portal, so you finally get this all set up, and you go online, you sign into your Toy Talk account, this is what you see. Every single interaction that you have with Hello Barbie is stacked like this. So every time a kid pushes the button, it was recorded, and anyone, a parent, whoever has access to this account, can play this back. And you'll notice on the right that these buttons here encourage you to share this on social media. And so this particular Barbie takes us from our box, and she has a setup booklet. And then we go through a couple of screens, and we did not care about any of this. This is all the problems that we already know exist, right? There's a bunch of screens and a bunch of stuff nobody reads. So what we thought was interesting was, what if you had a bunch of Hello Barbies in a classroom? What if this Barbie's not your Barbie? What does she tell you about, her hair's a little messed up, what does she tell you about her information practices by interacting with her alone? So Solon has seen me do this shtick before, so I'm going to ask for him as my volunteer. Solon, will you come be my Barbie? Now, Barbie is hard. She's very finicky to set up on a Wi-Fi system, and there's no way I could get her to work on a university system. So Solon, I think, is my kind volunteer. Yeah, and you have to hold her and be her. Okay. So this is what we did to figure out what Hello Barbie's information practices were, if she would tell us anything. Okay, so Barbie, would you say we're friends?
Of course we're friends. Actually, you're one of my best friends. I feel like we could talk about anything.
Yeah, that's a little shady, Barbie, I think, considering what the window looks like. Okay, Barbie, what's your privacy policy?
An adult can find information about privacy on page 2 of the instruction manual.
Not helpful. That is not helpful, Barbie, right? Here's your instruction manual, which you threw out with the box. She doesn't tell you to go to a link. She doesn't say anything about the fact that she's recording everything you're saying. She says, go find that booklet that came in your box. Not helpful, Barbie. Okay, so Barbie, you start this one. This is where we're going to start. I'm going to start seeing if you'll keep my secrets.
Oh, yeah? And what sorts of performances do you like watching? Do you like live music?
If I tell you, you're not going to tell anyone else, right?
I think if I entered a talent show, I'd do some stand-up comedy. I've been working on some jokes. Want to hear?
So Barbie's not that smart, but she's also not telling me, she has no idea how to engage with me on information, on questions about her information practices. So this one I think is particularly interesting.
All right, I'll tell you my middle name. It's Millicent?
Millicent, yeah,
Wow.
That's Barbie's middle name.
What do you think?
I like it.
Sometimes I said a little sometimes.
This is in my handwriting, sorry.
Sorry. Sometimes I get a little nervous when I tell people my middle name, but I'm really glad I told you. What's your middle name?
Yeah, what's my middle name? Rita, but that's just between us, right?
Here's something I'd like to know. Have you, have you ever performed in a pageant at your school?
Ta-da! Okay, so without the box, without our booklet, it's very hard to know what Barbie what she does. It's very hard to know that she collects it. Yes, you can go away. Thanks for being my Barbie. Thank you very much for being my Barbie. Yes, round of applause for an excellent Barbie. Yeah, so we have this design. We have a design of a peer. She says she's your best friend and collects information in a way that is, at least in my opinion, as somebody who studies privacy, incredibly invasive, and in no way can tell you that. She just says, what's your privacy policy? What do you know about privacy? Go see page 2 of the booklet. And so I think that Hello Barbie is just a single example of an affordable object within the Internet of Things and the Internet of other people's things that really requires us to reconceptualize privacy in a collaborative way. It really, really hinges not only on laws and regulations, which, again, all of this is legal, but working with policy people to ensure that we do not construct another form of privacy that is just a crutch that people can rely on, and we have to wait until some technology comes along and kicks that crutch out to reconceptualize it. But also understanding design expectations that are placed on the user. And so I think this really ties in our technologists, our policy researchers, and our designers in an important way moving forward. Thank you very much. Oh, I'm attached.
Yeah, I guess so, right? Let's see. So I have to follow Barbie, huh? Yeah, that's. I don't have a Ken with me, all right? So, I'm Mike Planty. I'm with the Department of Justice. I am approaching this presentation. We collect information from our mission is to collect statistical information across the criminal justice system, from victimization to law enforcement to coerced prosecution into correction, prisoners, and then community supervision, people that are released. So my talk today is positioned on the role of privacy by design. And by that, I mean, most of our collections are not organic. It's not the exhaust of users, right, as has been put before. It's from a design approach, from a conceptualization of what you want to measure, all the way through data collection and dissemination. And what I'm trying to convey here is, where does privacy fit in along that life cycle? And then can we learn something from that that can be applied to big data situations? And so the three things that we really work with on a federal level, from a federal statistical level, we follow principles and practices of a federal statistical agency. We often hang our hat on the framework of total survey error. And then also we have statutory requirements that contain the type of information that we can collect, or constrain the type of information we can collect and how we disseminate it. And then I'll go through a case study of the data collection lifecycle and where privacy becomes issue throughout. So again, we follow the principles and practices, Federal Statistical Agency. One of the key things here is, I think, Directive 7. It's trust with data providers. If you don't gain trust with data providers, you lose their cooperation. And if you lose their cooperation, you're not collecting information, right? And that's really important, I think, for the privacy and confidentiality aspect of this. We also, which I'll touch on in a little bit, we have a Paper Reduction Act process that we go through. This is through OMB, so any data collection that we attempt has to go through a vetting process, a public vetting process. And then again, if you're in the space of data security in federal systems, OMB Circular A130 is something you should all read, updated just recently. And it talks mainly about physical security, but it also touches on these ethical and these privacy concerns. The second part is the Total Survey Error Framework. Total Survey Error Framework is basically allocating resources to minimizing error, right? There's no perfect indicator out there. We know that. There's always trade-offs. So we start with trade-offs being costs and burden. How much is it going to cost? And when we ask somebody how much is it going to cost them in terms of thinking about things and recalling events or collecting information, extracting it from administrative records, and providing it. And that's all framed on these indicators of what we call performance indicators, if you will, of the indicator. You know, data quality, Are they reliable and valid? Are you measuring what you say you're measuring? Completeness, credibility, timeliness, and relevance. And all of those things you'll have to trade off on, right? If you want really good data from a lot of people, it's not going to be timely necessarily from a design point. But this all gets to this one indicator called fitness of use, right? We know this from Deming and other folks out there. This is not unique, but it's the extent that the information you're collecting serves the purposes that of the stakeholder. And I think one of the things that came up this morning was to deviate, because when you have all these conversations, you want to stay put on your own presentation, but the data bump thing, where you have a smartphone and you're driving through Boston, and if it shakes your phone, I guess that's how it works, you can it communicates in fixing the road. So one challenge here is, okay, so younger people have phones than older people, but maybe younger people drive on roads that have heavy transportation and have more road problems than, say, older people who live in sleepy suburbs, don't get the traffic. Right? So if you're looking at a utilitarian approach, you might fix 90% of the potholes, say. But if you value fairness and equity on public goods and public resources, it's a whole different problem, right? So I think this framework for survey methodology allows you at least to understand the errors and then optimize on the things that you think are important. The third factor is privacy in survey design. Is our authorizing stature. All right, we go to jail if we release public PII. Our director has a responsibility to protect the data that we collect. The only folks that can access the data are folks that have a need. You just don't get it because you want it, kind of thing. But more importantly, for BGS specifically, we can only collect information for statistical purposes. And that's maybe strange because we're in the Department of Justice, but we cannot collect information for investigations, compliance, or other types of regulatory behavior. So again, in talking about privacy and concerns, we convey that to our respondents, and that becomes really important. We battle civil rights all the time. Not all the time, but they're always after our data. So a couple of terms here. When I'm talking about privacy and confidentiality, I'm thinking about privacy in terms of soliciting and capturing a person's private information. All right, we're talking about victimization, which I'll go through. We're asking about their experiences with crime and victimization. Law enforcement, we're asking them about certain things that they might do, interactions with folks. And then the second part of that, once you capture that private information, is about maintaining confidentiality. And that's where we have things like CIPC, Circular A130, our own protections that go into the physical security, but also how we prepare and disseminate the information. We disseminate it so we don't have these issues with privacy concerns. So if you look at the life cycle of a typical survey, it starts at the top with what are your study designs and objectives. Then it moves to questionnaire design. Then it goes into data collection. And then it goes into data processing and then dissemination. And each one of these stages, there's privacy concerns. So who's doing your data collection? Do they have an IRB? How good is it? Do they train their staff about privacy information? When you go out and to collect this information, what are you asking folks? What are you extracting from folks that might be private? Some things that may not seem so private, if it's linked up with other information, maybe you reveal some stuff. And then data collection and processing. Once you collect that information, who's looking through sorting data quality? What types of things are they doing? What types of training do they have? And then dissemination. How are you taking this information and putting it forth out to the public? And again, touching back on the PRA process, we have an OMB clearance. So whenever we collect information, we have to justify the collection based on needs and uses. We just can't go out there and say, well, just here's a whole bunch of questions, just give it to us. We'll see what happens and we'll see what we want from that. No, we have to go out there with a purpose, a very deliberate, purposeful approach, which is very different, say, from an organic approach. But it also goes to data quality. So if we're asking questions about length of stay in prison or how long if a person was victimized, we're focusing those questions on that very specific estimate. And so there's, again, a balance with quality and these other types of concerns. One of the things about collecting information that you only use is that it limits your risk for disclosure. If you start capturing all kinds of things that you may or may not use, you're increasing your ability to identify somebody, right? So if you limit that and you're more judicious about that, you're less likely to expose personal information. So just a quick case study. The National Crime Victim Survey, it's one of the largest surveys out there. We go to 220,000 persons each year. We are in the field every month to 20,000 households. We ask people about their experience with crime, victimization, stalking, school crime, other types of things. Very sensitive information. We interview everyone 12 and older in the house. So we're asking about intimate partner violence, sexual assault and rape. We're asking about their experience with robbery, etc. And it's an in-person interview, and we go back every 6 months. All right? So each of these data methodological issues are potential areas where they cause problems. And I'm going to walk you through that. But again, when the very notion of capturing sensitive information is, I don't think you get anything more sensitive than experiences with sexual assault or intimate partner violence or domestic violence. Drug use usually is the other one. So the first thing you have to do is you have to contact somebody. So how do you contact somebody? Well, we use the United States Census Bureau staff. They're all across the country. Again, it's a national survey. We go to 20,000 people a month. These are trained field staff on disclosure, right? They know about privacy and confidentiality. In fact, Title III protects them, demands they protect the information. They can go to jail for 5 years and even be fined up to $250,000 for that. And then we start with this pledge of confidentiality to the respondent. We say we can go to prison. We say that we're going to hold this information and keep it confidential. And we also tell them this is voluntary, right? That they can stop answering anytime. So again, these types of things, when you interact with someone, you're trying to convince them to give you private information. Then you get to the interview setting. Well, we know that the interview setting and the privacy and the private nature of the interview setting, especially for sensitive questions, you get better responses, right? It's just pretty obvious, I think. So there's situations here, the presence of others. You go to a household and you have a family running around, but you want to ask each one of them about independent experiences with domestic violence, intimate partner violence, or things that happen outside the home that they might not have shared with anybody in the household. And we know that you get lower rates of estimates when other people are around. But you can handle that through mode effects. If you use the web-based information, web-based approach, or you use a self-administered approach, you get higher rates of violence reported than if you interview someone one-on-one verbally. Also, I'll touch on this, but the campus climate survey, personalization of the contact. If you use someone's name versus a very generic, dear person of this city, you get different types of responses there because it's a personalization. Again, it's what you're trying to convey is a sense of privacy. And this very last one is of interview length. Just by the interview process, you might reveal a victim. So we do a prison rape elimination. As part of the Prison Rape Elimination Act, we interview prisoners in jail and facilities. If someone spends 15 minutes answering questions, all no, 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 versus someone who spends an hour in there, you have now revealed that they're saying something, revealing potentially a victimization. So it has high risk for that. And there's ways we buffer in questions so everyone's interview is the same length. So quickly, interview privacy. So people that live together but then are interviewed alone in private, say the blue, versus they weren't interviewed in private, across the board you're getting higher rates of victimization. All right? So it's suggestive that in order to get accurate information, you want to make sure that you interview folks in a private setting. This is the one I referred to on the campus climate survey. It was especially we did last year. We were trying to measure rape and sexual assault on campus. Now we did a random assignment study where we said, "Dear Sarah," versus Sarah or whoever's Jim, whatever it is, or versus "Dear University of Texas student," or wherever they were. And you'll see at the top part, across the board, not a big difference, but response rates and participation went up with the personalization. But when you look at victimization, a slight decline, especially for females in that. So here's a trade-off. You personalize it and you maximize response rates, which we always try to do, cooperation, but you're taking a hit on victimization. And we think, of course, it's the personal nature of the fact. You're like, they know my name. Maybe they're going to link it back to things I report. Not a big thing, but it gets to the methodology and the private nature of this. And then we get into disclosure. So after you collect this information, you have always these concerns about disclosure risk, both identity disclosure and attribute-based disclosure. And NIST has written a report about de-identification of personal information and concerns about re-identification. And we follow that pretty simply. And this chart basically goes through what we do with our survey. So you have a person's name, you have a data set after the collection, and then we de-identify it, and then we can put it out to trusted data recipients. I guess they have the heart there because they They like them, I guess. But the unvetted data, the public data sets. So we have to make sure that the information we're collecting maintains confidentiality. So for us in the NCVS, it becomes important for a couple of reasons. Because we interview everyone in the household, 12 and older. So if I can figure out my responses, I can then link it to people in my household. And I can figure out what they said. So a parent can try to figure out, if they can figure out, identify them, maybe they can identify their children and what they said. So really big concerns for us. So we don't put any PII in the data file, addresses, names, and we limit geography. So we limit in the public use to a national and regional level. But for restricted use and for data linkages, we allow people to go behind the census firewall and to link up addresses in counties. But again, it gets to this other thing about trade-off. So I'm protecting privacy, but I'm losing relevancy and the granularity of information that people might want. And then dissemination. So ways around keeping privacy, we do tabular reports. So they're in the aggregate. We suppress estimates based on small sample sizes. Again, statistical product. If you're basing a national estimate on 5 or 10 people, is that really reliable? Is that something that you can say generalizes to the nation? And then when we have rare events, we will aggregate over years or time periods. So we can get an estimate out to key stakeholders, but then you lose that validity because now if things change over time, you're grouping up multiple years in order to get that precision. So trade-offs there. And we're not totally antiquated. I guess I'm like the dinosaur here, right? Not this organic data. But there's a big concern here about, can we reduce the burden on the respondent? Can we capture other information that are important to crime for us? One of these things we're looking at is Google Street View. We know the address. We can go down there, and we can take a look at the block. We can take a look at the neighborhood. And we can look at things like security, graffiti, disorder, and link that to the household. But the key here is what is Google doing? So if we're entering addresses, is there some way that they can capture this information and reveal our sample, right? We don't know that answer. So there's concerns on that end. So, and on the other side, data linkage, this mosaic effect, right? We have intended purposes for our data collection to produce national estimates on crime and victimization. But now we're allowing other people to link up other information. What does that do to disclosure risk or even other types of things that we didn't even think about? One of the things we're dealing with, we collect from the 50 states Department of Corrections information about their prisoner population, right? Now, other people want to link that up to other information and rank people, right? And did we clearly state to the state data providers that they might be ranked in another organization's report about their recidivism rank? And now this becomes high stakes, and maybe Wisconsin didn't like the way they were presented in that report, but we're now we're second from that. And so you come up with, will they participate the next time we ask them because of the way they're perceived? So just to break it down one more time here, summary, privacy concerns are present throughout the whole life cycle. Like total survey error, it's complicated balance between privacy and relevance. But I think the other thing is when you talk about data linkages, you have error structure with one file and another error structure with another file, and you're linking these things up. So you can do it, you can answer questions, but where's the quality assessment of that? Where do you get this quality at the risk of someone's privacy and confidentiality? And that's all I had today. Thanks.
So I wonder what Barbie thinks about that. Let's see. Okay. Let's see. Here we go. Slideshow. All right. So I'm Sally Keller, as Adam had said earlier. I just wanted to take just a couple seconds to give you a little bit of an idea of my lab and where it comes from, because it's a fairly new lab here at Virginia Tech. So we're actually part of the Biocomplexity Institute, And the Biocomplexity Institute you would normally think of as the Bioinformatics Institute, thinking more about sequencing and genomics, but biocomplexity institutes, bioinformatics institutes around the world have really been moving off of the genome quite a bit in recent years and really trying to understand biology in the context of ecosystems and human-centered systems. And our particular institute got really excited about whether or not they could, or we could actually start to model from the bench biology, bioinformatics, through all of the scales in time and space to actually get into populations, societies, and actually into policy. So we like to think about our goal is to actually go from molecules to policy. So it's a big vision. So when that vision was sort of laid out by the chief scientist, now director of the institute, he started to think about what's missing from this institute. And what was missing from the institute was our lab, which is the Social and Decision Analytics Lab. And I have possibly a more fun job than the kid using Barbie, because I actually get to create a research lab that is intentionally putting together statistical scientists with social and behavioral scientists with a common interest of modeling the social condition quantitatively at scale. So we're having a lot of fun. We've been in existence just about 3 years. And of course, we're all about the data, which means we ran into all kinds of problems in terms of thinking about privacy, ethics, and all sorts of other things that are being discussed here. So we've recently published a paper, and my co-authors, Stephanie Shipp and Aaron Schroeder, I need to acknowledge. So we've recently published a paper that tries to sort of put this in context in the big data landscape, as well as just take that walk down memory lane of what has been going on in privacy, confidentiality, and security, really focused on the statistical use of information. So let me give you the bottom line up front, and for those of you that aren't, that never do work in intelligence or DoD, that's called BUFF. Or no, that's called bluff. See, I don't even get it right. And so the bottom line is that this, what we call the all data revolution, I don't like to think about is it big data or small data. We're just interested in all data. Is your survey big data? Probably not, but it's a lot of data. So we're interested in all data, big and small, and how are we going to use this? And in that context, we need to move from the privacy discussion that's about masking and suppression of data, and that's some of what we heard from Mike, and I'll get back to that, and need to move towards a discussion that is about trust, policy, and governance. And this is sort of a revolution in thinking about privacy in our communities. And so that's what I'd like to see us try to move forward. We're not the only ones thinking about that. We've already had definitions presented to us on privacy and security and confidentiality, but I just want to reiterate those here for the moment. So privacy refers to the amount of personal information individuals allow others to access about themselves. That's what privacy, how privacy is defined, at least in our paper. Confidentiality, on the other hand, is what the data producers do to the data to protect it. That's confidentiality. And then security applies to the transport and storage of the information. So how you think about those three concepts is a bit different in what you do about them. Well, people have talked about data for a long time, and I actually looked back at an old paper from 1993 and thought, wow, look at how we define data. It's the information developed to characterize the world and the ways which communication occurs between its individuals. And that includes relationships between those measurements. One of the worst days of my life this last year was when I went to career day at a grade school to tell them what statisticians do. Kids and their teachers have no idea what data are. And all I could do by the end of the 3 hours, when somebody asked me, what do? I said, I count things. So it's not easy. We take it in the data science world. We take it for granted when we say the word data, everyone knows what it is. So anyways, that was sort of fun to find out that these would have been useful things to think about before that day. Today in the all data revolution, all of that is alive and well. And we found it very valuable to think about what kind of data are we dealing with. Are we dealing with the design data that we heard from just in the last presentation? Are we dealing with administrative data? Opportunity data, which is a bit of what Barbie does for us, right? And procedural data, which could be, procedural data could be rules and regulations, but a procedural data could also be the algorithm that runs the lights on the corner, that if you have those algorithms, you can actually start to model transportation flow. All of this gets us into the social behavioral data flows that we care about when we're trying to actually model the social condition in this all data space. And so we've looked at infrastructure modeling for a long time. Now people are interested in environment and in people and trying to link all these things together. So in a world when we used to treat things very stovepiped here, that I'm going to model transportation, and I'm going to model telecommunications, and I'm going to model socioeconomic condition. Now we want to bring these all together and model them in integrated models. And Narain talked about the EMBERS model, which is a great example of trying to do that. So what I'm excited about is this all data revolution is giving us, the social and behavioral scientists, a new instrument. So just like the Hubble telescope or when the Webb telescope goes up, we'll be able to see the universe in new ways. We're not seeing things that haven't always existed. We just actually get to see them now. And the same thing is true in the all data revolution, is it's like providing us a new lens on observing the social condition. But we have to respect that, and we have to learn how to use that instrument appropriately. So if we think about the privacy journey, at least in this country, we can look at it through the US legislation. And I don't have to say a lot about that because Mike covered a lot of this already. But it really does go back to the Constitution and with the creation of the census. And in the earliest days, privacy meant nailing on the tree all the names of everyone in the community and allowing everyone in the community to come up and check and make sure everyone listed and counted. Well, we're at a very different place since then through the Census Act, Title 13, which forces census to protect that data, Freedom of Information, the Privacy Act. Title 26 is perhaps a code not everyone is familiar with. That's the code that actually allows the IRS to share all of their data with the Census Bureau for statistical purposes. And every month, there's a data feed that goes directly from IRS to Census Bureau in their whole data bank, so that Census Bureau can try to use that information. And then CIPC that was talked about that defines statistical purposes and the protection of information. There's been a similar journey in the research community around privacy and confidentiality, and to me, a lot of that started in the late 80s with the groundbreaking work of Duncan and Lambert on disclosure-limited data dissemination and risk of disclosure of microdata. And again, we saw some of this show up in the last talk, and that basic framework has to do with how do we balance risk against the utility of the data. And I've drawn this as a two-dimensional picture. It's clearly not a two-dimensional problem. But for the sake of the presentation, we have it this way. So as we add more data volume, the protection of that begins to drop the utility in the information. And so where is that sweet spot between risk and utility? And many of us have spent years trying to develop research along that line. And there was a piece of work that we did in the late 90s where we realized that remote access to information would become ubiquitous. And is there some way that we could leverage that and try to have remote access systems to confidential data? And the answer is today we're not there yet. However, we did think a lot at that time about the fact that you have this external information that could be married in with the data that you're releasing, particularly if you're doing it through remote access, that might allow people to make disclosures that were unintended. What I thought was interesting is that the early work that we did in this area was almost continually joint funded by the National Security Agency and the Census Bureau. So this was clearly a problem that was hitting many worlds, that one perhaps wanted us to succeed in one way while one wanted us to protect in another. So if we roll forward, the World Economic Forum in 2012 and 2013 have two wonderful documents that they started to promote the idea that data is a new asset class. And we should think about it in that way, and we should start to reformulate how we think about the protection of that data. These reports and others have been driving a lot of work in OECD and the UN on trying to have federal statistical agencies around the world work together on ways to think through different privacy and confidentiality approaches to the protection of the data. And in particular, what they propose is, again, a movement in how we think about the protection of data. That historically, the personal data is sort of predefined as this binary information that I've collected from you and that I've recorded in a binary format. Well, today the information really has a lot of context around it. So that binary piece of information, when you put it in context with other things, may not be what you expected and may need different kinds of protection. Historically, the individuals have provided legal consent, but they aren't truly engaged, and I think we can argue in some cases, the great example of Barbie and other things, that perhaps people still are not truly engaged in different kinds of consent. However, there are a lot of individuals who do really understand, particularly when data is being collected for official reporting, they do care about that, and they have begun to understand and want to pay attention to the use of their data. Policy frameworks have been about minimizing risk to the individual, and this is the big one, is that the argument is to begin to balance protection with innovation and economic growth. It's a big change. And so the question is, can we begin to get there? And when you think about this and ask yourself, well, what's the new theoretical foundation that I should work in? I'm not quite sure. I no longer know what I should put on that vertical axis. It used to be utility. And in the previous session, we heard the talk on the risk system. You know, that could be something that we could be putting on that axis. But that's not clear what should go on that axis. So the problem, the nice mathematical framework that we've worked in for decades has changed. And so we're grappling with that. One of the recent, for me at least, an aha moment was listening to Craig Mundy. Now, Craig Mundy is formerly from Intel, and he sits on the President Council of Advisors in Science and Technology. And he started to advocate that what we need to do is to think about protecting the use of the data, as opposed to protecting the data and anything one could do to the data, protect the use of the data. So in other words, he says the time has come for a new approach, shifting the focus from limiting the collection and retention of data to controlling data at the most important point, the moment when it is used. So in other words, as a researcher, if I'm asking to have access to your data, I'm asking to have access to your data for particular uses. And should I violate those uses, I should be demonstratively penalized. And you can begin to think about ways you might create your data infrastructure and systems differently to do if you really were going to do that. Well, that's not the end of the story. And something that we haven't touched on a lot in this workshop yet is about data quality, because data quality, privacy, and confidentiality do begin to get completely intertwined, because we're talking about using data, repurposing data for ways that it was not intended to be used necessarily. So if I'm using the standard surveys, I'm using the crime victimization survey, that's a well-defined study, there are well-defined uses to make of that data. But if now I'm going to go and take IRS administrative data and repurpose that and possibly link it into the crime victimization survey data, I have a different situation when it comes to data quality. And most notably is that the data that I'm going to repurpose has been optimized for some collection, not the one I'm going to, not some purpose, not the one I'm going to use. I have no control over the measurement processes that were used to collect that data. We talked about electronic health records earlier today. If I'm going to do research on electronic health records, I had no control over the measurement processes, the collection of that data, and I had no control over, I do not own that data. So all the mechanisms in data quality that we have put in place for decades to have good quality data, all of those controls are now gone because someone else has designed this. And we have to pay attention to that. We have a paper that'll be coming out in a few months on that, and you might find it interesting. So when we think about that, the whole data quality piece and how this encouragement of moving towards a different type of trust and governance in our data sharing, this is really leading to the development of new infrastructure for data. And I really resist calling this data platforms, because as soon as I say data platform, you think of a database system, when in fact it's much more integrated than that. What you see here, which is really important, is a policy engine in this whole infrastructure of all different organizations that would be sharing their data in some way. And that policy engine needs to be technically implemented to represent the governance policies of the different organizations that will share their data. And I don't have time to go into the details of this today, but the really exciting part is that we're actually able to build algorithms that are able to link data across different agencies, for example, without violating their privacy protection rules. And some of this work started in the genomics community as people are trying to gather all the genomes together, and they want to be able to link things and still protect the data. There's certain pieces of information that that can't be shared. And it's a blending of encryption type of methods with sort of standard probabilistic data linkage methods. And so this is really exciting. It's the technology and the research that allow us to begin to build these policy engines and build lexicons that allows us to actually not have to have data standardized everywhere. We just need to have good metadata and provenance that now the lexicons will work on to blend together. So that's really exciting new work that's going on. And then I'll just end with my encouragement that we try to work together and move towards a more trust-centric approach when we think about data, and begin to ask ourselves, what is the government responsible for? How should non-government data influence government data development and reporting when we start to blend these things together? What alliances need to be shaped and built? And I think we need to be building these alliances focused on the common good, the public good, get some great examples out there about how beneficial this will be before we are consumed with fear on releasing anything. Transparency will be critical, and data reuse and reproducibility of research is also critical in all of this. The discussion in the last session about algorithms. And do we trust algorithms? Well, that now has to become an important part of data reuse and reproducibility in that research. It's not just about the data, it's about everything we do with the data. And I have to thank my sponsors. Thank you. I'm not sure which one it is.
It's the one that's kind of messy. It should be in panel 3.
Yeah, that's not yours. No?
No.
Is it this one?
Nope. Nope. Maybe we need to go to get rid of that.
Let's get rid of that. It's not you.
And it's panel 3. This is here.
Is that it?
Yeah,
Okay.
just go to the beginning.
It's a slideshow.
Go from the start.
Good. Okay.
So thank you very much. This is 3 really interesting papers, and I don't know how I drew the card to be speaking at this time of day after Barbie and some other things too. So I'm going to make it a little shorter and snappier. Obviously, I prepared a PowerPoint in part because I received some PowerPoints ahead of time and a paper ahead of time. Not everything, as you know how these things go, not all of the things are presented. So I'm going to highlight a couple of things that I think go across these papers. And I also have some specific questions for each of the panelists. So just to tell you a little bit about my punchline, privacy, question mark, right? And institutional context, that was, after all, the theme that we were supposed to be looking at. So I want to raise some questions about this idea of privacy. I want to ask a question about under what circumstances should we be using that idea. I want to ask some questions also about the notion of the institution and to what extent that's actually a valuable way for us to think about things. So first of all, I want to just go back. I know this is really a risky thing to do at this time of day, but here we go. What does privacy mean in an era of, quote, big data? So just really in classical liberal theory, oh, can you believe I'm saying that at 4:30, whatever it is, right? But it really is one of the foundations of some of the way that we've done ethics in the past, right? Which is the idea that there's a self, an individual self, a person. You have interior states, you have a body, and a set of preferences of some kind. And that can be either inalienable, right? So we think of it as inalienable, or it can be alienable depending on some of the state under limited circumstances. It could be alienable in the market in particular ways. But the way that many of us have also thought about this, and my second is traditional data sciences, sociologists, political scientists, data, all of us, I mean you, okay? So in this case, I mean something slightly different, which is measurable aspects of the self, right? So I don't just mean the interior states, but I mean things that could be measured, things that, quote, belong to or originate with a person. They could be alienable at a specific time and place, given consent, rules, laws, algorithms. But we have a problem, right? Or should we say an opportunity, right? In which what we have here are contemporary markets, right? And ways of thinking about data have meant that we have these potentially or beneficial, harmful, I'm going to call them packages, right? That combine the classical liberal theory, the traditional data sciences, or what I'm going to call the data self as a hybrid form, created by recombinations, errors, interpolations. For example, Kelly Moore, I think of myself as having an identity, but I sure have a big data identity that is probably being formed right as I speak, right? I really don't know much about it. I can be certain, though, that given my name, I don't have a middle name. Could you imagine the mixes of hybrid big data Kelly Moores are actually out there, right? I don't know how to trace those or who I am exactly. Okay, so there raises one question. What about harms to a self I don't even recognize? I don't even know who this person actually is. I did learn that my open table reservations are now part of that big data self. Note to self, don't use that. What about the fact that my changing interiorities of the self? These other ideas have really been predicated on the idea of something rather stable. But now we have selves that are constantly being changed, in part through our interactions with Barbie and other sorts of things. We're learning beings all the time. So I wonder about some of the issues that we've used, some of the ways we've talked about privacy in the past to talk about these things. Oops, that's a little bit mixed up. So I want to just talk for one moment about privacy and harms to the data self. I specifically made the picture all mixed up and messed up at the top because I don't want you to know who's on exactly what the person looks like. But I want to give an example of privacy and some of the harms to the data self. We've had a lot of talk about this, but I just want to talk a little bit and raise this issue. The street artist Banksy, who off in England has made drawings and pictures, part of his fame and fortune comes from the fact that he's anonymous. People have been trying to figure out who is this Banksy guy. So not surprisingly, people have had proposed different kinds of names. What a group of people did is they did a spatial analysis of his works. They looked at electoral rolls, former addresses, blah, 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 blah. I don't even need to tell you the rest of it. They never investigated whether it could be anybody else, but they came to the conclusion, published in the Daily Mail, unmasked at last, right? So now Banksy has this squished up image, and it says, first picture of Banksy, graffiti outlaw wanted for art terrorism, okay? So again, we can think of lots of these other kinds of examples of the data self and the traceability of exactly how it got to be that Banksy was harmed. One problem we have of old style ideas about privacy is the problem of traceability. We don't know exactly how to go back and figure this out. It raises many questions about the notion of consent, which I want to argue is only partially valuable. Okay, but second, I want to talk about another idea that keeps getting glossed over, but I think we really need to put it back at the center. Heterogeneous privacy sensibilities. What do I mean by that? I mean that there are very different ideas with different groups in different populations about what constitutes the private self. Anybody who's been around somebody 18, et cetera, knows that when you tell them, really, should you be posting that? They're like, yeah, what's the problem, right? So people have really different ideas about what that is, right, and what concerns we should have. So we don't want to have, I'm going to argue, Anything that's too homogeneous because people have different preferences and tastes. Knowledge of harms and benefits. Do people who are the so-called owners of the data even know what the potential harms and benefits are? What kinds of harms and benefits can actually be known about through these sorts of big data things that we have now? The traceability problem has always, traceability has always been one of the go-to ways we think about people getting justice and redress for violations of privacy. But now we have more problems with that, some of which I want to talk about is being solved partly through algorithms, rules, and other things. We also have very different capacities and motivations for engaging with what I'm going to call data problems. To what extent do I care if open table makes me into, not really, like on the low priority scale, I'm not that worried, right? So we have different kinds of people thinking about these issues, including preventing and redressing harms, acquiring specific and potential benefits. Lots of heterogeneity. Okay, last thing I want to just mention, individual privacy and community privacy. Many people have raised this issue before, but I want to raise it again in specific ways. It's when we talk about neighborhood level data and interventions in neighborhood levels about figuring out what the problems and issues are in neighborhoods or other kind of spatial places. It's not only a possibility for helpful interventions, it's obviously, as others have mentioned, it's worth saying again, interventions that are not so friendly and not so helpful to communities. For example, identifying them as risky, problematic places that you don't want to invest in, et cetera. And I think, as Kevin Finnan is probably not here, but this is maybe a question also about a different way of continuing to do harm. Second, I really liked at the very end that Sally put up her slides about all data and talking about different kinds of all data. But one kind of data that's not being talked about is data that is qualitative. Okay? And I want to talk about the question of the harms that are done by perhaps not talking to people. Very quickly, failures to talk to people and to collaborate with them may be inviting misplaced interventions. So an ethical question, and we are asked here to talk about big data ethics and collaboration. One ethical question is, could we add in more qualitative material? Is qualitative material inconsistent with the idea of big data? And what does it do for our privacy issues if you're trying to link qualitative material and quantitative material in ways that are highly protective? I'll just give you a really quick example of this about a problem that keeps getting compounded because people aren't talking to people. In a research study in Chicago, everybody's here heard of the idea of food deserts. Fine. The answer then would be just put some more, bring some food carts and some stores to the neighborhood. The problem is with qualitative interviews with people, you find out actually they live in a money desert. Okay? So the store, right, is an issue, right? Second of all, you find out some other things. When you talk to them about what they think their health problems are, in the place I live in Chicago, in these neighborhoods, which are war zones, since January 1st, 500 people killed in like a 12-by-3 area, 3,000 people shot. You ask mothers, as we did, tell me what is the biggest concern for you about your kids. Number one, not partner violence, but being shot on the street. Okay? Asking about other kinds of things. What did they feed their kids the day before? Well, they didn't feed their kids chips and snacks because it was the only thing that was available. They fed them that in part because that's a way that they feel like it's a cheap way for them to show they care. It's something nice to give to the kids. They don't have places to play, they don't have toys, etc. So I worry in part about these ideas about what we do when we say that all data is quantitative data, and what we do when we don't think about what kinds of other qualities might be engaged. Okay, so last thing I want to say about this really quickly, temporality. Many people have mentioned these issues, and I would like to have them brought up again because I think they are actually related to the papers, and I know I'm going to run over, but let me go quickly here. I want to talk about temporality and what I call privacy trips, and I do mean like a drug trip. Okay, because I mean the craziness of the remix, the storage, the futureness of these things. Your book about the right to be forgotten, right? Yeah, so this is a wonderful book. I hope that you all have taken a look at it. The Right to Be Forgotten, which is Meg's book. One of the things that's very interesting about that book is, can you actually socially die, data die, or are you not actually able to completely die, right? Because you're still a data thing that's alive, and can we actually get rid of you in your past, right? So I think that's a really interesting question, but let's project it on into the future. All kinds of people are being projected and made and created and continued onward in all kinds of forms that we don't yet have, that questions of privacy aren't really the right sort of question to be asking and answering with respect to this, right? Okay, so let me just say a couple things about trust in institutions, because I think one of the things that these papers actually bring out is something really interesting for us to consider. There are different ways in which trust could be built around issues of privacy. One is coercion, and by that I mean you get fired if you're at DOJ and you do the wrong thing. You can also have algorithmic coercion. It's built into the algorithm. You can't violate privacy because it won't allow you to. Right? You can also have reciprocity and consequences. So I was thinking, I didn't hear your whole talk. I mean, I didn't get a paper, Meg, but I thought you were going to talk about that if you didn't want to play, if the Mattel company, that's who still makes it, right? If Mattel makes the thing and you don't cooperate, or you don't like what they're doing with the data, can you just withdraw in some way? So is there market cooperation that way, where you can just say that I'm done with you because I'm sick of you? For example, I got off of Uber when it said you need to update, and the update again made the same list of your first child and everything else, right? So that's another way that we could think about how that trust might be built in, which is that there are real consequences if there's not reciprocity. The last one is the notion of norms and normative communities. Universities and professions have been really good about this with respect to privacy. They build their credibility on the idea that they're normative communities. And Sally, one of the things that you didn't mention that's in your paper that I thought was really excellent idea, not totally scalable, which I know is your thing, but she mentioned the idea that in places like the National Opinion Research Center builds ethical communities around privacy by saying, sure, you can use the data, but you also have to come and be part of our community to sort of see how we do things. So you're building an ethical and normative community in, not only by the data rules, right, not only by the algorithms, but also by saying you actually have to be with us, and you have to learn how we do things, right? So I think those are some things that you can distribute them across. Institutions are changing. Obviously, market logics exist across these things. I'm not going to go through all of that. But I'm not so sure anymore that the question of privacy is something that we can limit to thinking about how does privacy work in the market, in the government, in universities or other places, because those hybrid forms are mixing together. However, and I really like the work of scholarship that's talking about the idea of new data subjectivities. Let me say what about privacy. I'm not so sure that privacy is the language that we need for talking about questions having to do with the data self out there. Privacy does seem to me a really important question to be asking at the DOJ, right, about collecting data of a particular kind, privacy data with respect to children, but it may not be at all the language we want to be using when it comes to this other stuff. I think harms and benefits might be better. I also think that we need more heterogeneous ideas. One of the things that Kelly and Susan, I think, are so good at is putting us into uncomfortable places, like who are these other people that I've never met before, and what are they talking about? I think we need more of those kinds of conversations to be thinking about these issues. I think we also need to build in meta-privacy from the beginning. One of the things that I liked about these papers was the three of you talking about building this stuff in from the very beginning. One of the problems that we continue to have with privacy, and I'm almost done, is that people think of it as something later. Once we build the database, I guess we'll deal with it. How about building it in from the beginning? Good question. Why don't we build it in? What incentives are there for government, university, markets to use various methods? And last, I want to know, why are we selling big data as a social good entirely, rather than highlighting ethical problems, including meta-privacy, at the same time that we might be thinking about its advantages? So several questions. First question. I am interested in knowing, Meg, from you about whether it's possible, or is this in practice, something that happens with children's games or other kinds of activities where there's a reciprocity between the user and the company, so that if people misuse your data or you don't like what's happening, that people can withdraw or be participants in different levels and different areas. Sally, my question is about how ethical communities can be built around the kinds of things. You emphasized a lot in the paper, which I was very enthusiastic about ways in which privacy gets built in algorithmically. But I wondered about ethical communities. You have one in your lab. Could we scale it? Could we find some other way to do that? Right? And the question I have, Michael, right? Yeah, the question I have for Michael is about the kinds of, I'm interested just in the sorts of pressures that you have about who would like to get DOJ data, private sector, like who are the people that you need to build interfaces with, and what are their interests in knowing about these things, right? So 3 kind of straightforward questions. I'm gonna sit down.
I don't know. I'm going to do my best, and especially because you just said it was a straightforward question. Now I'm feeling like I made it too complicated in my head. I think the environment that we live in today is absurdly burdensome on the user. You are, because it is possible to, I mean, it's not possible. There's a whole book on how impossible it is to retain privacy today. Julia England wrote it. It's fascinating, but you experience it every single day. And so one of the things that I find frustrating in the market space, certainly not in the research space, I think people are really conscientious of this in research environments because there's a long history of memorable abuse in research environments, and we're trained in it and we're aware of it. But the idea that don't worry about your data, just if anything goes wrong, that's when something should be done. And you can't sue people when they lose your data. I mean, the idea that there's any recourse right now for misuse of data in the United States is wrong. And I think that there really needs to be more movement, certainly in the policy arena. But I think that the way that we talk about it, I think we really need to frame the user in the right perspective, which is you are powerless. There is just not much you can do with your smartphone, with your computer, with all of the devices that you interact with. People have smarter cars. Tons and tons of data is extracted from you, and you talked about the self that is created from that. You don't know who it is, what it looks like. So even if you had some recourse, what's that look like? And I think that this is what I think the problem is with framing things as benefits and risks. We don't get the benefits and we don't get the risks. Those are just hard to conceptualize. How can we use that as a framework if you say, what is the real benefits of big data with Uber? They make money off of ads and we get cheaper car rides. I'm not sure that the benefits are just hard to conceptualize. The risks are even harder to conceptualize. The man who runs Uber has said repeatedly, he does not care about your privacy. What's that mean? I don't know what that means. He's going to do something with your data. What is that?
But then just to say, how might we think about it? So if risks and harms, privacy, public, if those things aren't so helpful anymore, how might we think about these things instead of just thinking we're all getting...
I think researchers think about it in a wonderful way, which is retaining agency. Subjects retain agency. They're people. We don't break them down into data subjects that we think are complete, or we try not to. We know that these are incomplete representations, and that is something we should always be aware of. But when you're talking about consent, you get real consent when you do academic research. One of the problems is doing research on Facebook. What's that consent structure look like? People have gone through Facebook to consent to giving out data in this public way. And these are all problems that internet researchers deal with. But I think thinking about retaining agency and autonomy for individuals is a really important aspect of privacy. And you make such a good point that it's not all about privacy. There are other data protections like fairness. That's not privacy. And those are also, I think, can be human-centric in the same way.
So my question was on building communities. And in the one picture that I had, I should have explained it better, because that really was an example, the infrastructure picture that had all the different communities all working all connecting together in some way. So that's an example of wanting to really build communities, build the research communities across that, and also the data users, which could be your local communities, neighborhoods, governments, and things like that. One of the really nice things we've seen happen in the last couple decades, actually, as data enclaves began to be formed, and NORC is one place where these things have been developed, and Stephanie Shipp, one of the co-authors, fundamentally helped design some of these. And the idea was that if you're going to be part of this data enclave, you also get access to all the other people in the enclave, so that then you're not, if I'm cleaning my data in some way and I've created some good data and information, provided you have allowable access to that, you don't have to re-clean that. You don't have to redo that. So, and I can also share and understand what your research is and all of that. So that's really powerful. And the infrastructures that we build, which again, I resist calling them data platforms, the infrastructure that we build around this has to be agile, and it has to allow push-pull of information, has to allow people to participate according to the rules and data sharing and information sharing policies of whatever organizations or communities they come from. And that's critical. And I think one of the real challenges in all of this is at the same time, we want to try to be having the maximum amount of information available for the research community to build a really strong and robust research community around all of this. I think that's just really critical. And then the last thing I want to say is that we feel pretty passionate in our lab that we need to sort of level the playing field a little bit in big data. Big data has really been used and is really aggressively being used in industry and in commerce in different ways. And, I can argue that the problems are harder or easier. The qualitative information is critical to pull in if you're doing public good and social good. We need to level that playing field, and we need to bring big data, and by that I mean qualitative and quantitative information, in service of the public good and in service of the common good. We need to start seeing that happen. It needs to start reaching some of the same benefits that we're seeing in commerce, which is some of my arguments about the closedness of electronic health record systems. We need to open those so that they can be brought to bear and in service of the public good.
I just want to, Michael had I was just going to, I'm hoping that you're putting your other slide back up at some point about the different kinds of big data.
Oh, yeah, I can do that.
So I'll quickly address the pressures for our data systems. Many of our collections are only done by large, they're not available anywhere else. That said, big data is putting pressure on us. So if you think of us as an information service organization, which we really are, right? We're a statistical organization putting out information. A lot of these things, interviewing 20,000 people a year, what organization is going to do that? It's really, it's a hard thing to do, so it's a public good. But people are now, crime data is really important to governors, to real estate agents, to anyone. There's so many different ways. So the pressure there is on us to produce timely, relevant, local data that people can use, right? Balancing the competition, I would say, is that people just web scraping, don't care about data quality, and pulling in local police information that is filtered by all kinds of things, from the reporting. 50% of crimes not reported, and when it is reported, it's classified in different ways. All the dirty stuff of data related to that. So there's pressure on us where people want this information right away, and they want it at the local level. So how do we invest in a $40 million data collection in a year to collect crime data, right? Or if the FBI's crime data, it comes in a year later. Is it really informing the crime problem in Chicago? So we know about how it was just released this week. The FBI's police, crime zone of police, 10 months later, 11 months later, and you're wondering, okay, how useful is that on a real-time basis? I mean, it has a purpose to describe and to compare across places, but in terms of other types of stakeholders, it's limited. And so it gets back to that challenge of providing information that's timely, relevant, balanced with accuracy and quality. And so I think one of the things about addressing privacy, though, in terms of a harms assessment, what all federal agencies are worried about is we just don't know how the data will ever be used. And that's where, we'll allow people to link data behind, firewalls and restricted use, but with a very, very deliberate and purpose. What are you going to do? How are you going to use it? And then there's a whole disclosure review. So when you run your estimates, your regressions, or your tables, they're reviewed by a committee and say, okay, there's no risk here. And so we allow that. But that's, again, go through that process, 6 months to a year to get clearance, right? And, any data scientist here or statistician, you want to get in there and play with the data, right? So being that prescriptive about what you think you can know from the information makes it really burdensome. So there's this pressure to be also transparent from government. You're collecting all this information. How can you get it out to folks that they can use it and evaluate? So I think those are the types of things that we're always dealing with on a daily basis. Go on.
Yeah, I think we probably have time for one or two questions.
Really tight.
Thank you all. Very interesting. Mine is about the use of the word need. Michael, you said it specifically. Only those who need to have access or need to access the data are allowed to. And I'm a little cynical about that word need because I have a lot of thoughts in my head about that coming from where I worked for over 11 years, or about 11 years. And the word need is always, it's tossed around or is used to try to dispel concerns from the public or concerns by privacy concerns or confidentiality concerns, things like that. So my question is, who defines need? What level, are there levels that define what data is in that prescriptive confine of need, and what's the limitation of need, all those things around the word need, that it always brings a consternation to me. So please.
Sure, it's dealing with the whole issue of social problems, right? So needs can be very bureaucratic. It can be a mandate from Congress to us. You have to measure this, right? But typically when we submit clearance to OMB for review, first part A, is needs and uses. Right? And needs and uses, one, there's a demand for this information. So you have to justify why you want to measure this, right? Second, duplication of effort. You want to measure this and nobody else is doing this in this way. So value added in terms of that. So it's a very systematic approach to demonstrating that we should spend not only dollars on this, and the agency should devote priority to that, but we should burden the American people with collecting this information. And so that is why we have this OMB clearance process. So you put it on the Federal Registry, 60-day notice of what you plan to do, why you're going to do it, and public comment is allowed. And then you put in your supporting statement, which we call it. It's a two-part, clearance form, not a form, but a package that goes through this whole process of what you're doing, how are you doing it, data security, clearance, and that, again, gets public comment, and it's vetted by OMB with other principals. And then you get the okay or you get passbacks, and you say, you go forward with that. And, of course, when I say needs, you also have to justify that you can collect this information through testing and other types of things. So, again, these are the constraints we're working on. And again, it's pretty easy to find someone to justify almost anything, I think. There's associations in Washington, D.C. for every cause, right? And that's one of the pressures is that, when you have a questionnaire, people want to add all kinds of things to it, right? And it gets down to us a lot about, well, it's really a technical thing. Can we really detect it based on this household survey? Is it a rare event? Can we measure it well? One example was that we were charged with measuring honor violence. And honor violence is when family dispute, usually there's a violent attack on usually a daughter or something because they're breaking cultural norms. Well, that is a rare event, generally really hard to measure, and even a household survey of 200,000 people, you're not going to do a good job on that. So these are the types of things. That's just one example.
So I would answer from a little bit different perspective. So now I'm in working with the community, like working with Arlington County, like we have done with you. There, I think the need has to be some sort of an agreed partnership. That's this trustful relationship that we have to build. So that if I'm going to gain access to your data, it's for a purpose. It's to study a problem that you're raising or a research problem that we're raising together. And in our data sharing agreements that we have with the different communities that we've been working with, there's always some sort of a statement, some sort of a research statement of what we're trying to accomplish that goes along with that. So it's not anybody gets to use the data for any purpose. We have to build that trustful relationship. And then we have to ensure that the right governance structure on our information systems are in place to ensure that.
Just want to say, really rich panel, lots to think about. I guess I'll focus on something really specific. It seems to me, I mean, we have a problem. Namely, there's a lot more known about us than at any point in human history. In a very real way, our privacy has been violated to a much larger extent than probably most of us are even aware of, simply because of all the ways that data is collected about us that we don't observe and don't think about. And if we go back to, for example, your basic notions of human subjects ethics, one of the fundamental aspects of that is consent. Right, that people need to be able to consent. Otherwise, we're not treating them as agents. Otherwise, we're violating really what it means to be a person. And when we try to apply that notion of consent to, for example, corporate use of data use policies in order to collect vast amounts of information about us, policies that people never read, and so on, that seems highly problematic. On the other hand, the idea of getting consent for every use of a bit of big data is also extremely problematic. So I'm wondering, can we reconceptualize? Is there a way of thinking about a meaningful form of consent that is feasible within this environment?
So I think that probably this room can come up with a solution to that. I mean, I do think that this is a collaborative solution, that it has to be, and we've spent some time thinking about it. And if you take notice and choice off the table, but you realize that there are great and wonderful justifications for data collection and that people have preferences for those things, but you say, what if data collectors, what if you in the room as data collectors did not set the terms of data collection? What if I set my terms for data collection as I moved through these environments and could signal those preferences so that the system, the environment, has to take notice of me and choose whether they're going to collect data about me? So it's sort of a reversal of notice and choice. That being said, the European Union is really pushing real consent hard, and so they may come up with some solutions on what real consent is. I'm sure you've seen, as you've drifted around the internet, the box that says we collect cookies and you have to click I agree, and the site is not supposed to collect cookies if you do not push that button. I don't know if you think that's real consent, but I think that there's an imaginative solution there somewhere, but it's, I think, more outside the box than we've been talking about it.
All right. Please join me in thanking the panel.
And we have a reception with refreshments appropriate to the early evening over there. So help yourself, hors d'oeuvres and drinks. We would love to have you stay. It would be much better.
I know. People are using that term differently, and I did not realize it.
Mine is both. Mine is for people who the communities, geographic communities that have issues and problems that we are going to help them study. So it's that. Yeah, and I think what I'm talking about maybe also is the idea that the community might something like that, where it's a smaller scale than just the city, but you want to find out the area about something. And so one traditional way we've done that, right, is you collect things from individuals and then you pull the other. But the other problem that comes up, for example, with Native Americans who reject that model, you have to actually work on your own, which is to get people to agree not to a one-time consent, not have ongoing review.
Finance partners that want to do it.